Remember, I told you I sent Max, my dog,
Cat.
at Tufts University, a cat.
Yeah, a comfort animal.
So she's applied for the permit to have the animal, but until then, she's got to completely hide it. You can't have animals in the dorm. So the RA, the resident advisor, she sends this picture to Max and goes, do you have an animal in there?
Oh, no.
Look at this picture. Look at this. Is that the ultimate busted? How can you deny this?
So what'd you say?
Tell him it's a Halloween decoration. And she goes, well, your Halloween decoration moves. It's the funniest thing I've ever seen.
So what happened?
Busted. The very next day, she got the approval letter for the
Oh,
cat.
thank God. I have a patient for you named Mellissa,
Yeah.
who is from Normal, Illinois.
Normal?
Normal.
Like abnormal, normal?
Yes.
That is, ooh, that's really short.
Look at that. There's no tip.
That's one of the worst I've ever seen.
I've been through 2 procedures just to have this nose that looks very similar to the nose I was born with. Dr. Nassif, can I get a tip? My childhood was rough. As far back as I can remember, I have been made fun of because of my nose. And there came a point where I think I was 7 years old. And I even asked my dad if I was meant to be a pig in life because it was just so put in my head that I had a pig nose and that's maybe what I was supposed to be. Sorry. That's hard. Oh my gosh, I didn't expect to cry. Oh gosh, this is brutal. I should have worn waterproof mascara.
This one looks fun. All right.
Hi, welcome.
Hello,
Hi.
thank you.
Let me know if you guys need help finding anything.
Okay.
So here I am at 38 with only one boyfriend my entire life. And that did not even last that long. I'm so self-conscious about it. Oh my gosh, dogs. Oh,
Love it.
See, I would love.
Too bad the nieces and nephews are too big for that.
Yeah.
Do you want kids? You never said you really wanted kids.
I know. You know, I didn't want to pass on this nose to them because I didn't want them to live with
That
it.
makes me sad,
I know.
honestly.
I don't want them to be bullied the way I was. Oh my gosh. I would love to look in the mirror and not focus in on my nose.
Nice.
And I can just hide my nose.
Melissa,
Hello, Dr. Nassif.
we know you're from Normal, Illinois.
Yeah.
What is a normal Illinois? What is
Exactly.
that?
Not us.
Well, first of all, thank you for coming in.
Thank you for having
So
me.
I have a feeling that there's a story here
There's
we want to
a
hear.
big story.
So let's start off.
My elementary school years were tough. I had a very upturned nose, very similar to this one, and I was called pig nose every single day.
So
of
that
my
was
life.
starting at the age of 6 or 7?
Yeah,
Can you imagine being traumatized that early?
and eventually, at the age of 14, my dad, he said that I should at least look into getting a rhinoplasty. And I remember the surgeon, he gave me an implant to elongate my nose. If anything, it just made it more broad and more protruded.
Well, it pushed out that way.
Pushed out. And then, as the months went on, you could start to see the implant.
Exposure.
Huh?
Oh boy. So when they pulled it out, did it just go back to looking the way it did pre-op?
You know, just didn't look any different. I would love for my nose to be longer. I actually don't think I have much of a tip at all, right?
So that would be your goal. Basically, a normal nose.
A normal nose from Normal, Illinois, yes.
Obviously, we can take a piece of rib, and I could put something in the nose to augment it so that the tip actually touches all the way down to the lips. I'm just saying. But it's not that, it's the skin. If we put the skin on too much stretch, sometimes I'll know it in surgery, I'll start turning a little bit discolored, then we know we have a problem. My biggest fear is that her skin is used to being this short. And no matter how much I try to stretch it, I just might not be able to get the best result. It's been 23 years or so. Why now?
In 2016, I was on Wheel of Fortune.
Oh.
Yeah, I won a car.
You did?
Yay.
Wow.
I did, and it was so exciting. And then I came back and I went to Twitter. Why did I do that after my episode aired?
Oh.
I know.
Social media is
What was I
brutal.
thinking?
Yeah.
Gosh,
Brutal?
I was compared to the Whoville girl. Yeah. It's so hard. The hardest part about having this nose is the constant paranoia that people are looking at me, judging me, pointing at me, talking about me behind my back. I feel like I should be embarrassed for the way I look.
By the way, I'm just going to call it out. I love the tongue situation.
What tongue?
She's got the
Oh, yeah.
the
Okay, I
list.
noticed
The
that.
list.
I do have a list.
It's so cute.
No, but I'm looking at the tongue as it's going like this.
Can you do funky shapes with your tongue?
Oh my God.
Oh.
You have a very muscular,
I can't do it.
acrobatic, gymnastic tongue.
Wow.
Why don't I have a boyfriend?
Hello.
I'd love to walk into an exam room all the time with this much energy. Wow. All right. Okay, they didn't touch your nostrils, right?
Right.
Okay, head back for me. All right. Can you do me a favor? Turn your head this way.
Do you think they harvested septum?
No, but I don't feel any tip cartilage here. There's nothing here. I'm looking at your hands right now. It's a little bit
White.
ash, you know, this color. You can see it.
Yeah. I have Raynaud's.
So you have Raynaud's.
Yeah, I do.
So that's a risk.
Okay.
Raynaud's phenomenon is where the little arteries which supply blood to the fingers and the toes, they just stop working. So when I stretch Melissa's nasal skin, is that gonna cause stress to the small arteries? That means I'm not gonna have any blood supply and I'm not gonna have any oxygenation to the nasal tip. Let's take a look at this. How do we elongate the nose? There's something called the septal extension graft. In addition, we take cartilage from the rib, dice it up into small pieces, add a blood product called fibrin glue, and make a customized implant called the diced cartilage glue graft to build this whole thing up. And we also have to add cartilage to the tip of your nose to make that longer. So that's the goal of what I would love to do.
I would love for you to do that too.
All right, so that's a goal. That's our goal.
Goals.
Now, let's talk about some other things. Let's talk about the negatives.
Okay.
Your nose is high risk. It's high risk because the Raynaud's, your skin can turn black on the tip and die. If that happens, we have a mess. Now, let's just say you do get that problem.
Okay.
The nitroglycerin paste, the hyperbaric oxygen, the leeches get called in. All these to help with the blood supply. I deal with purple noses probably more than anyone in the country.
Yeah.
I'm 100% on board.
I am excited for you.
Thank you so much for letting us help you.
Nice to meet you.
Nice meeting you guys too.
Thank you, Dr. Dubrow.
Normal, Illinois.
Betcha.
Normal, Illinois. I'm coming.
Hi. Good morning.
Good morning.
Good morning.
I'm Mellissa, here for surgery with Dr. Nassif.
Okay, great.
I've been waiting for this for 38 years.
All right, Melissa, we are ready for you.
Yay! Oh my gosh, this is
This is it.
Peace out, pig nose.
Perfect. Okay, come back down.
The biggest challenge when it comes to lengthening a short nose is really the skin. Is the skin tight? Is it loose? We just don't know for sure until we're actually operating and in there. For Melissa's surgery, while Dr. Peng is harvesting rib, I'll perform a septoplasty to improve Melissa's breathing. I will then insert spreader grafts and a septal extension graft to lengthen her nose, articulating rim grafts to lower her nostrils, and dice cartilage with fibrin glue to build up her dorsum and add more length to the tip of her nose. All right, so I'm opening up into the septum. Take that. It's deviated to the left. This is a good piece of septum coming out. There we go, that was deviated. Well, the good news is her nose is mobile, her skin.
All right, the ribio is coming out. The rib we took out is 6.5 centimeters, so we'll have a lot of cartilage to use.
Wow. She's really oozy. A lot of blood in here. When you have a good amount of bleeding from the nasal skin and the surrounding tissue, that's a good thing. We want blood in the area. That means the tissue is healthy. If we open a nose and there's no bleeding at all, then we're going, oh my goodness, there's no blood supply here. Can you bring me the spreader grafts?
Yep. Here's a really thick one.
Like that. We also need good septal extension grafts. All the way to the tip to lengthen the nose. I mean, this is actually gonna be pretty good. About a good centimeter, maybe, I hope. Let me have fibrin glue. Ready? Pop it in. Is she turning a little purple?
A little bit.
So I think we pushed to the limit. I think this is absolutely pushed to the limit. I'm not doing shit. This is my worst nightmare. Melissa's nasal tip skin is starting to turn purple. And most likely this is due to the Raynaud's syndrome. I don't even want to think about the worst case scenario. I'd put a little bit of nitroglycerin paste on her and gonna need a leech. Time is gonna tell us to see how her nose is when the room's a little bit warmer to see if that purpleness goes away. It is a little worrisome. We're gonna have to keep monitoring that. With me pushing Melissa's nose down so far, there's a little bit of decreased blood supply. So in regards to doing nostril reductions, no way, that's out. Because I can't compromise any further blood supply to the nasal tip.
After everything that I endured growing up with my nose, all of the bullying and 2 surgeries, I never, ever thought I was going to have my dream nose. Healing was a little bit of a bumpy road in the beginning because the tip of my nose turned purple and then I had to have 3 leeches put on my nose.
Oh my gosh.
Insane.
Ever since then, it's only gotten better and better. This is a completely new and refreshing chapter of my life.
It's a new day and it's
Dr. Nassif has mad skills. I love my tip. Even during the day, like, I'm at my computer and I'm just like,
I love it. It looks so natural, but it also still looks like you know.
I agree. When I look at myself in the mirror, I really feel like this is the nose I was always supposed to have.
Mellissa, you know, she's always been beautiful, and now that she has this new nose, you could see in her heart that she truly believes it now. Like, finally you see what we've all seen, and the whole package, it's amazing to see coming from her.
The other day, I pulled behind a school bus and I just looked at everyone and I waved. And they waved back at me too. There was no finger pushing up the nose. There was no making fun. They looked at me like, oh. Before my surgery, my nose was short, severely upturned, and I didn't have a tip. But now, thanks to Dr. Nassif, my nose has length, my nostrils aren't on display, and I have a tip. It's exactly what I've wanted since I was a little girl. And I can finally put the past behind me. Peace out, pig nose.
Whoever gets the bullseye, the other's treat.
I like it. I am so excited to live in Normal, Illinois, finally, with a normal nose. I need a little more. Oh,
Maybe.
now that's a tip. Oh my gosh.
Are we having dinner tonight?
There's a brand new pasta place. They actually get their pasta from Italy. That means the pasta is probably about $100 a plate.
Another expensive pasta place.
You know how I always do the bathroom trick for you? So I get out of paying for the dinner. Get up,
Go to the bathroom.
go to the bathroom, tell the server, drop the check
Now.
off now to him.
You have bill-induced diarrhea.
I do.
What do you
I
got?
have a patient named Carolina, had a dog bite
Face?
to her nose.
To her nose.
She lost the whole tip. Voila.
Oh, this is...
Yep.
Right now, my nose looks horrible. One nostril is bigger than the other one. My skin is uneven. As much as possible, I avoid a mirror because I don't want to look at it. It makes me feel anxious. All right, let's rack them.
All right.
Typically, I don't like people around me, so I don't go out. If I do, my daughter, Christina, drags me out of the house almost physically. Before this happened, I will go to like, hey, it's Friday, let's do happy hour. I have a glass of wine with the friends. If I will walk in a room, I'm gonna make you notice me. Now, big difference. Holy Christmas,
Oh, I got the white. Okay, but I got it in.
A doctor tried to fix my nose. He took the skin from my neck, the cartilage from my ear, put it on, and keeps falling off. He never told me how many surgeries I was gonna have done. It's been 6 years. I stopped counting after the 15th or the 16th one. It just, everything is like, look, wait, just let it heal, and then we'll come back. Didn't make it any better. Just keep making it worse.
We've been on a long journey, and I think we're on finally the right path.
How are you?
Carolina. Right?
Yes.
De España.
Sí, claro.
First of all, welcome.
Thank you.
When did the dog bite occur?
So it's gonna be 6 years in
6
September,
years.
yeah.
So tell us exactly what happened.
I went to a friend's house. I sit down on the couch. I reached over to grab my cell phone, and the dog just lanched.
So he was walking, all of a sudden,
Right. I remember just walking to the bathroom, and I'm thinking it's got to be just like a nip, you know? No. It was like bone, you know? Yeah, yeah. It's
Took all the skin off.
yeah.
So what did they do in the initial setting?
They opened my face because I have stitches, you know, from here to here.
So you had a flap, right? And it was attached.
Correct.
Right? It was still attached? It's called the nasolabial flap or a cheek flap. And then what happened?
We just had to wait until all the stitches were out.
Were you given antibiotics?
No.
When you have a dog bite, you have to give the patient antibiotics. Basically, they put a flap over Carolina's wound infection, which I'm sure she did have, and most likely that's what caused the flap to fail. Did the skin die?
Parts of it was keep falling off. After that, he took the cartilage from my ear.
Yeah.
After that, it was from the left ear. That didn't work.
Same doctor?
Correct. Yes, same doctor.
Wow. Did you ever start to lose faith in this doctor?
My doctor was keep saying one more. It's going to be one more.
Right.
You know, one more. I believe him. You know, after 4 or 5 years, 6 years, it's like, you know, okay, it's one more.
And you always wear the Band-Aid on your nose walking around?
I
Really?
will not leave the house without it.
Yeah.
No. And if
Do
I
you
forget
leave
it,
the house?
Barely. No.
You know, she used to go out all the time, and now she doesn't leave. It's affected her work, her social life. She definitely has depression from it.
This depression is no joke. And to see myself like this, you know, weak, I can't be like, you know, the person that I used to be. Sorry.
The next thing that we really want to do is go to the exam room to say, okay, is it fixable? And if so, how? Then if so, what are the risks? Hello.
Hi.
You know, I noticed that you're extremely thin. When we look in your face, you have no fat. What is that from?
Trust me, I don't look at myself in the mirror. I don't weight myself. I can't eat a whole 4-course meal or anything like that.
She doesn't eat. Like, she wakes up in the morning, and they could be all day, and she doesn't eat anything.
Because there's no appetite.
I appreciate Dr. Dubrow and Dr. Nassif. They are more concerned about the bigger issue, you know, which isn't just cosmetic. It's, you know, mental and physical and emotional too.
Were you this weight during these surgeries?
Yes.
One of the things, too, that could have been a reason for some of the failures is your nutritional status.
Yeah.
You're malnourished.
It's been 6 years of
torture for my mom, and I don't want her to live not one more week, one more month, or one more year in the state that she's living in right now.
Put your hand back. So that is a thin layer of skin. So that is from the skin graft.
Yeah.
Can you put your hand back a little bit more? Oh, it's just that it's kind of hanging. This extra piece of tissue. But they cut right here. I'm looking in your nose. Sorry. Oh, it feels weird. And you're a little sensitive there. I just was touching the inside. So let's talk about how you would fix this.
Okay.
Now, first of all, you have to make me a promise. Get your health in order. Christina, you're gonna have to monitor that.
I will.
Like a lot. Even though Carolina is not in the best shape in regards to nourishment and protein intake, she still is a surgical candidate. However, to be able to heal well, you need to be healthy. I need her to eat a lot of protein and more of a balanced diet during the healing phase so that everything will go well. And the way you're looking right now, if I do an open rhinoplasty and lift up the skin, your body can't tolerate that. But there's something called a composite graft. Take a piece of ear cartilage and let's do a closed rhinoplasty and let's just see what we can do to make the nostrils more even. All right, I just want to feel this. Okay, so they took all this. Might be able to find something. I'm going to say on that one, 50-50 that I can do it.
If I may, one of the things that people enjoy when they come to see us, because we've had all this experience, is we provide hope. When you start to see maybe in the future, this is going to be where I need to be, then you start to feel better.
Yeah, I agree.
To be able to enjoy life.
Right. No, I think that's the best.
You're up for it.
Yes, up for it.
You got to take care of yourself.
I guess we're gonna buy some protein shakes today.
Good morning, sunshine.
Good morning.
How you feeling?
Super nervous, but happy.
Let's see. How's your nutrition been this weekend?
I've been drinking.
Protein shakes. And I'm actually eating breakfast now.
You feel your caloric intake and protein intake has been better?
Yes, thank you.
All right.
We'll take good care of you.
We'll see you in the operating room.
Okay, it's showtime.
Showtime, let's do it. For Carolina's surgery today, while Dr. Peng is harvesting cartilage from Carolina's left ear, I will be performing a closed rhinoplasty rather than an open rhinoplasty because of her poor nutrition. I will start by making an incision on the right nostril and create a pocket for the composite graft. From there, I will move on to the left nostril to remove what I believe is ear cartilage. Then I will add the composite graft to the right nostril to help lower it. And finally, Carolina will receive a laser treatment to help reduce the redness. All right, Christine, 15.
15 legs.
So you can start with that ear. Give me a scissors.
Need a chair, Anna?
So I'm stretching the nostril to make space for your composite graft. All right, so that's number one. Now I'm gonna work on the left nostril. When it comes to Carolina's left nostril, our goal is to make it more aesthetically pleasing. There's some extra tissue hanging down, and my goal is to remove that. We have to go piece by piece. We can't just make one big cut because I'm worried about is loss of blood supply. I wanna see if there's any way I can get underneath that and unroof it. I don't think I can, but let's just try to be magical. I'm just trying to peel the skin off. I mean, the good news, the skin's bleeding. There's one piece that was hanging. I'm just gonna take a little small tidbit, okay? Take that. That's skin.
I have good news.
Is it scar
It's
or is it
actually
cartilage?
Cartilage and some scar.
Damn, girl, that's beautiful. I didn't think that Carolina was gonna have a large piece of ear cartilage for me. Let me see the composite graft. God, I can't believe it. You got one that big. This is so unexpected. And now I'm gonna take the composite graft, stitch it in on the right side, and lower the nostril. The goal is to make the nostrils appear somewhat more symmetric. Oh, I think it looks pretty damn good. I'm gonna say we're about 75% even. Then Laura's here to laser profractional for texture and the redness. So when would be your next treatment?
Like 3 to 4 weeks from now?
Okay, hopefully by that time she'll come in gaining 10 to 12 pounds.
Yeah?
I mean, damn. Love it. Carolina probably has about another 3 to 4 treatments. However, I'm not sure of the result we're gonna get because the skin is just not great. We're trying to give it a new surface, make it look of the texture a little bit better, but only time will tell. Thank you, bless you.
How are you feeling?
Like all night, I was just like, come on, is it time? Is it time yet? Hi.
Hey, how are you?
Hello, you
Good to see
two.
you.
So
How you
excited.
feeling?
I'm stuffed.
I thought you mean your stuff for eating.
Yes,
Have you been
actually.
doing that too?
Yes. My witness.
Christina, handshake?
We have been eating more.
All right,
Okay.
so let's see. Okay, I'm gonna just take this off.
How's it look, Christina? How's it look, Christina? How's it look?
Really good. I think you're gonna love it.
Oh my God.
What do you think so far?
Six years. 6 years.
It's a little bit of a miracle.
Give me a hug.
Thank you. Feel like some energy boost. You know, just like somebody just put like a shot of positive in through your veins, and you just want to like, okay, you know what? This is the day. This is my day. This is gonna be my day, and from here on, you're gonna continue, and you're gonna get up there, and you're gonna gain the weight, and no more depression, and you're gonna start doing exercise, and you're gonna live.
You don't suck.
No.
That is really good. This may be the most improvement for the least amount of surgery you've ever done. I'm so happy for you.
I can't wait till back to that so I can keep looking at myself in the mirror.
One last time before I go.
Thank you.
Take care of yourself.
You too.
Please do.
Thank you so much. Bye.
Dude, it's good.
Unbelievable. After 6 years and almost 20 surgeries, this is a new chapter in my life, and I just can't wait until what's next. After the surgery with Dr. Nassif, Laura did 3 lasers to get rid of my physical scars. It will never be perfect, but they're great.
I'm on top of the world.
We're celebrating you today.
Salud, my love. I am alive. My daughter doesn't have to drag me out. In fact, I'm the one who's dragging her out. Thank you for pushing me to go, with Dr. Nassif and Dr. Dubrow. It's like, I'm a part of the world. Before my surgery, my nose looked hideous. I was never leaving the house. I was depressed. My skin was just completely uneven. I had to wear a bandage every time that I went outside. But now, thanks to Dr. Nassif, and after the laser, my skin is even again. I finally feel like I can truly live again.
You look beautiful.
I could swear the bartender was checking me out too. I don't know, but the doctors really scared the shit out of me. When you hear 2 doctors basically point blank tells you like, hey, if you don't change, I can't help you, that woke me up. Is this like chorizo?
Well, I think it's salami.
No, it's salami. I eat 3 meals a day, and now I got muscle, and now I'm 115 and I feel good. It's like day and night. It's like you lived in the dark so long. You feel your heart pump that blood, and you can run a marathon.
I would love to see you run a marathon.
Well, okay, I'm exaggerating now.
My mom is back. She's happier than ever. She's better than ever, and she's going out. It's great.
Hey, listen, it's my day. Like you used to think the dance.
Oh my God. I'm gonna pretend like I did not see that.
Got there.
I have a lovely patient named Renee. Voila.
What is that?
My nose looks like a windshield wiper. And I have a bone that looks like a chiclet. I've had 3 rhinoplasties that left my nose worse every single time. This is what I ended up with, a nose that isn't attached to my face. I hate looking in the mirror and seeing this nose that doesn't even look like me.
Hi, ladies. Got some bread.
That looks really good. Thank you.
Of course.
I'm scared your nose is gonna like pop off your face.
It feels like it's gonna pop off my face. Just push it right there and then.
Oh my gosh, that feels so weird. Wait, I've never felt it before.
Can't wait till Dr. Nassif takes that away, if he can. I have not gone to any other doctors because I was debilitated with fear. But if I wait much longer, I feel like it's going to pop through the skin. The skin feels very thin here. I don't want any other doctor touching my nose except Dr. Nassif. I don't even know what's holding my nose together right now.
Renee.
Hi.
Hi,
nice
Dr.
to meet
Nassif.
you.
Welcome. Where did y'all come in from?
Wait. What'd y'all?
I like that, though. Where'd y'all come in from?
So we suddenly.
Where did you all come in from?
New Jersey.
Oh, New Jersey. What part of New Jersey?
South Jersey. Yes.
Jersey
Gym,
Shore.
tan laundry,
Yes.
GTL. Do you even lift, bro? You do not lift even, bro.
I do.
You,
bro.
By the way,
I do.
Do you even have a trainer, bro? Answer, yes, I do. Oh, fire him, bro, because your trainer sucks, bro.
I just fell asleep and I completely forgot what the question was.
What?
I know that you have a history of having rhinoplasties.
Yes.
So let's go back and tell us, why did you even have the first one?
I always felt as a kid that my nose was big. Around 19 years old, and I talked my mom into getting me the first one. I came out of the first surgery and had like a bump, so I asked them to redo it. As it healed, I liked it for quite a few years, but then the cartilage here shifted over to this side, and this collapsed right here. This started falling down, dropping more and more and more. And then I just lived with it, had my children I had to raise. Then it was time for me, and I went and saw a reconstructive surgeon. Before I went into surgery, I told her I love my bridge. I said, all I want to build up the side that collapsed.
So the doctor said, let me put in some rib there?
Yes.
And you woke up and what happened?
As the swelling started going down, you could see my bridge was loose. I was shocked.
When did it start getting this mobile? Pretty quickly after?
Pretty quickly.
All right. Many doctors build up nasal bridges, dorsums with rib. Sometimes they just put a big piece of rib in. And with Renee, that rib has to come out because it's not properly placed and it's just too big. And that's why she has this mobile thing on top of her nose.
What kind of work do you do?
I'm a hairdresser.
Oh, and you stare at it all day.
All day, and all I see is that. Like, I just hate seeing up my nose all the time and this hang this down.
Are the nostrils about the same or worse right now compared to what they were 3 years ago?
I definitely think they're worse.
Worse.
Yeah.
So basically, you want to bring this in and lower the nostrils.
Yes. I haven't dated in 3 years. I mean, could you imagine going on a date and doing this?
Oh,
like
wow.
That?
Do that again?
You know, like you're like you itch your nose like all of a sudden, and
I feel like it's gonna fall off.
I'd be devastated.
So it really made you feel self-conscious.
Yes.
I want her to find somebody and be happy.
Exactly. So here's what I'd love to do. Let's go to the exam room, check everything out, and then at that point we can look at options. So let's go do that.
Thank you.
Hello.
Hi.
All righty. You know what I want to do.
Yes.
All right, hold on, let me just feel this. Ooh. Wow. It almost looks like it's gonna pop out of the skin. Oh, jeez.
Is that all rib?
This is all rib all the way to here. And then you also have rounded flat tip. You know, the cartilage is just kind of has no oomph.
Yeah.
I'm looking at the skin.
It's thin. Because this was done 3 years ago. If it's that thin in 3 short years, what would happen in 3 years from now?
That's what I was thinking.
It's gonna pop through.
All right, so let's talk. Once we remove the piece of rib cartilage along the dorsum, your bones are gonna look not great.
Oh.
I have to take a piece of rib, again. When I remove this large piece of rib in Renee's nose, her dorsal projection here is gonna disappear. So I'm gonna have to rebuild that. And I will use a diced cartilage glue graft from fresh rib that we harvest. We'll be able to build up a beautiful bridge. We're gonna use a piece of that rib to give her stability around the tip, and we're gonna make her nose look fantastic. On top of the bone, there's something called periosteum, which is a very tight layer. What we like to do when we're putting an implant is to get it under the periosteum so that it doesn't move.
Yes.
So your tip is going to be very firm like mine.
Yours does look nice and firm.
It's firm.
Yeah. I think Dr. Nassif has an excellent nose, and I'd be happy to have one just like it. Except he has a man's nose. I want a woman's.
There's always a risk from what we call the three-dimensional healing and the shrink wrappage of the skin around the nose to cause irregularities, asymmetry, and I'm worried about the skin. Renee's skin. It's so paper thin that while I'm operating on it, I can easily pop through it. But you want to do this?
I absolutely am so grateful that there's you to do this.
I think it needs to be fixed. I don't want it falling off her face.
Pleasure to meet you.
Pleasure.
I'm excited for you.
Yes, thank you so
need
much.
this.
It's the last time I'm ever going to be able to do this.
Oh, please stop.
Never again.
For Renee's surgery today, I'll start by opening her nose while Dr. Frederick harvests rib. I'll then remove the rib that was used in her previous surgery and create a pocket for the diced cartilage glue graft. Next, I'll add an articulating rib graft on the left and then do an alar base reduction on the right to make Renee's nostrils more symmetric. Finally, I'll place a piece of rib tissue perichondrium on top of the diced cartilage glue graft in hope that that will combat shrink wrappage of the skin. I'm gonna start. Let's go after that rib. So this is all thick scar. Trying to open up this here. Shit. See, it's stuck. Ooh, Jesus. Give me a 4x4 quick. Take this out. I'm gonna cut right through the skin. All right, let's make sure that hole doesn't get bigger. Jesus. All right.
Do you need like a plain cut?
No, at the end we'll put some stitches in it. Okay, so here's the rib coming out. Well, this really was stuck to the skin. Now that the rib is out, I need to create a deep pocket for the new implant. So what I have to do is go under the periosteum. Here's the bone, here's the periosteum. Make an open space there so I can insert a new implant. So that's the rib coming out.
Yeah.
Because this pocket's gonna be the key to everything if I can do it. If I don't do this, we'll be back to the starting point and her nose will deviate all over again. Section. Give me the diced cartilage glue graft.
Here's what we got here.
Go ahead and shove it in. Keep going all the way in. Go, go, go. Okay, come off. Give me your perichondrium. So we put the perichondrium on top so it won't get stuck to the skin. I'm just trying to make the tip, a little sharper for her with my suturing. Look at the nostrils from down below.
A weir would make them more symmetric.
All right. A weir incision, and by the way, weir is from the name of the doctor that invented the procedure, is what we call alar base reduction. It's taking a pie slice of tissue out of the nose, and then you stitch it back together to make the nostril less wide. And in Renee's situation, this is gonna make her nose look more symmetric, but also a little thinner, not as wide. But that's a hell of a lot better. All right, so I think we did a pretty darn good job. I mean, her nose should not get crooked. That implant's not going anywhere. I love it. All right.
I wonder what Dr. Nassif had to do to your nose.
I don't know, but I'm in a lot of pain.
Hey.
Hey.
Hello.
Hello.
How you doing?
I'm okay.
Are you in a lot of pain?
Just the rib.
Okay, so I want you to make sure you're walking around.
Okay.
I want you to do deep breathing. Hold it and let it out. Really get some good pressure to open up your lungs, okay? I'm just gonna peel away this just a little bit, okay? Okay. That looks pretty damn good.
That's as straight as can be.
All right.
First of all, what'd you find in there?
So I found that the rib was stuck to your skin, and the scissors just popped right through your skin. There was a little cut in your skin there.
Yeah.
Okay.
And I put some sutures there. It took me a good half an hour just to remove that piece of rib.
Wow.
And then we worked on pulling this up. And your tip right now is a little high. It's a little bit rotated, but that's gonna drop with some time.
Thank you.
So time will tell, but I was really feeling good about it.
Okay.
So I feel that where I got it, placed it, I wasn't getting any movement. I feel it's pretty solid.
Awesome. I'm so happy that I'm no longer going to have a nose that shifts around like a windshield wiper. Overall, I'm very happy with Dr. Nassif and what he did.
I think it looks great. Thank God you got the surgery when you did.
I know.
Yeah.
I'm happy. I'm happy it's done.
Yeah.
It's done.
This surgery has changed my life tremendously. It's made me feel better about myself. I was reminded every single day of my 3 failed rhinoplasties. I felt terrible. I wouldn't dare go on a date in fear that they would see how my nose moved.
Hi. How are you? So good to see you.
Before my surgery, my nose would shift back and forth, and I thought the bone was going to pop right through my skin. Now, thanks to Dr. Nassif, I don't have to worry about my nose falling off my face, or if I itch my nose, somebody's going to be freaked out because it goes to the side. I really want your hair like stacked up to here.
I don't like how it does the flip on like the shoulders.
You don't like that? I love that. My self-esteem's coming back. My confidence is coming back. I'm feeling more whole as a person.
It's good to see you smiling again.
Yeah, thank you.
Dr. Nassif and his team did a wonderful job.
They're true rock stars in my eyes. When I'm at work now and I'm glancing in the mirror, I'm actually finally feeling better each and every day. This experience has made me feel that I'm stronger than I even thought. I can start a new chapter just by never having to think about a bad nose again. Moving on from it and it not consuming all the thoughts and all the insecurities that came with it.
You look beautiful.
Thank you. Looks excellent. No longer moves.
It's all behind you now.
Yes, never have to think about a nose again.
What's happening?
Look, come here. Meet Xaverie. Look at that.
His nose is in the other room. How is that even possible?
Xaverie's jumped and grabbed, the basketball hoop, and then the thing broke and came down.
Wow.
And hit him in the face.
What is this guy, 6'8"? This guy can dunk?
I don't think he's that tall, so he must have a really great vertical jump.
Oh, really?
Yeah, like me,
Like you?
Yeah.
What is your vertical jump?
Oh, okay, now wait, hold on.
Here, just jump straight up. Let me see if you can jump.
Hold on, you ready?
Yeah.
All right.
Go. No, that was like 8 inches.
That was bad?
Yeah.
Hold on, that hurt my knees, though.
Jumping up and down hurts your knees?
Well, it does.
3 inch up, 3 inch down.
3 inch down.
Damage to your knee. Poor guy. So, what's his name?
Xaverie. He's here with his mom. Let's go see
Oh,
him.
really?
Yeah.
Is he sweet or Xaverie?
Well,
He
I'm
may be
sweet,
both. He may
and
be
you're
both.
Xaverie.
He may be both.
I'm sweet, of course.
I've had 2 rhinoplasties and 20 injections to get my nose straight, but my nose looks like it's sliding off my face. My friends, they like to drill me for my nose constantly, no matter what the situation is. They say my nose is always pointing south. I look like a Picasso. If I give them shit, then they'll say, oh, I'll smack you in the face and I'll correct your nose. I've heard that one a lot. Basically, I look like a fighter who's never actually fought, which is not fun. How's work treating you?
Busy.
Make it? Yes. I got 1, that's impressive. I did not see that coming, I'm not gonna lie. Well, in the 9th grade, I was 15 years old, and me and a few of my friends were playing basketball, and I ended up hanging off the rim, even though the backboard said, do not hang on rim. And the whole net came down, the backboard smacked me in the nose. I started bleeding everywhere. Everyone was like rushing to the scene. Went home, didn't know that I broke my nose. A few years later, it had a massive bump on it and pointing to the left slightly. So my mom suggested that we go take care of it. How many years has it been?
Your first surgery?
Yeah.
Since 2018.
Oh my God.
And it was downhill after that.
Plan was to go in for 1 surgery. Here I am, 2 surgeries in, and I still don't have the desired look. He got rid of the bump, but now at this point, my nose is more crooked now than it was before. And so I'm just struggling to breathe, looking ridiculous. It sticks. 0 air is going in.
I'm really sorry, Xav. I really, really am. Yeah, I just wish I could give you back the time that we've lost. There's an extreme amount of guilt. Because not only did I take Xaverie to the surgeon that botched his nose 2 times, but it was my job to protect him and I wasn't able to.
Yeah, we've been through it, but I don't know, builds character or something. I don't know.
I have a question before we start. Can you dunk a basketball?
No, I had a little help with that to get to the rim. In high school, I was 4'11", was very undersized, so I got a buddy to kind of like lift me up just to kind of like hang off, and like my whole neck comes down backboard, smacks me in the nose.
A few years after the trauma, I was going through some pictures and I kind of noticed that it was like slightly crooked, but it wasn't severe. The bump was really the issue. So we went to the doctor who had performed my nose surgery. He was a plastic surgeon, but his main focus was facial.
Okay. What happened after the surgery?
She knew it was not a great surgery right off the bat. The second I came out of the
The minute he
OR.
came out.
How'd you know?
I said to his dad, it's crooked.
Really?
His nose is crooked.
Even with the cast on,
Oh,
you
yeah.
can tell.
The tip was like here. The doctor said, you know what, the swelling has to go down. I already knew there was going to be a revision.
So then what happened?
Went in for the second surgery. I had a little bit of hope when the cast came off initially. It looked a little bit better in terms of it being straight, but over time, it started to go back to where it was. It kind of reset. What he suggested was in the 3-month period, he wanted to do 20 fillers on the right side of my nose.
20 injections?
20 injections.
Okay. Hyaluronic acid. Juvederm?
Yeah.
Okay. So over a 3-month period, you have fillers in the nose to try to make it look straight, and?
Didn't work.
At all?
No.
Did it give you fullness on the right side of your nose?
Maybe a little bit of fullness, but again, over time, that kind of faded anyways.
And then what happened?
Scheduled a third surgery.
With
The same guy. Boy,
Yeah.
it's getting worse.
So what happened?
I got ready for the procedure, got in the hospital again and everything, and I was absolutely petrified. I was actually shaking. Went to my parents. I was like, I can't do this.
So
Trusting your gut.
before he got back to the nurses.
Smart boy.
After you walked out of the procedure that day, was your nose like it is right now?
No, it wasn't this bad.
Probably collapsed quite a bit too since then, I think.
When you do surgery and you manipulate the cartilage, it's gonna look usually fine for a while. 6 months to a year, that's when the deformities start to occur. We've had patients that have had surgery 20 years ago. The nose was fine. Year 21, the nasal tip cartilage starts to change. That's what we don't understand about the nose. That's why it's hard surgery.
I did take him to a second opinion, and it was like, no.
Why?
Trust issues.
And we actually also had another consult in Costa Rica. Xaverie has a house in Costa Rica.
You have a house in Costa Rica. How old are you right now?
I'm 21. Yeah, I have an Airbnb in Costa Rica that I run.
Good
Two,
for you,
actually.
man.
Oh, there you go.
You know what? You should trust your gut for the rest of your life.
Yeah, I think that's a good
Suspect
call
you're a
right there.
bright young guy.
Thank you.
Xaverie,
Yeah.
what do you want?
I just would like a straight nose, and I would love to be able to breathe again. Cardio's hard for me, because, again, breathing, so I get flushed pretty easily.
Were you this fit in high school?
Not at all, no.
What do you do?
A lot of weight training, a lot of eating. Yeah, I felt like that was the only thing I could control, because obviously my face is kind of butchered at this point.
So let's do this.
Okay.
We're gonna go to the exam room, examine your nose, and then I'll have you open up your shirt.
All right.
Okay? Let's go.
He just wants to see how ripped you are.
That's true. We're gonna compare all three of our chests.
Okay.
I'm not looking at my shirt.
Oh, that's... All right. Before we talk, I want to just examine everything.
Before I say anything, I'm going to say some things.
Put your head back for me a little bit. Oh. You didn't tell the doctor to make your nose smaller, did you? Your tip?
You think
Make
my
tip?
nostril smaller, though?
Yeah.
Okay. Yeah, I notice every time I touch you go.
I'm incredibly anxious, to be perfectly honest. Yeah, I don't know what to expect here.
Oh, shit. That's kind of one of the worst symptoms I've seen in years.
Wow. It is warped. Oh my God, like this big bowed thing goes in and then comes out.
It's a roller coaster in there.
The fact that Dr. Dubrow and Dr. Nassif's taken back by the internals of my nose is terrifying.
The septum is completely dislocated. Wow. And this is really from bad trauma, which you could have had this from the 9th grade basketball. It's pretty damn bad. I mean, I'm even a little bit fearful. Now, how do you attempt to fix this? Let me see your right chest.
Sure.
You already know where I'm going at this. Right about here, about that big, you need an incision. You gotta take your rib cartilage. I've had rib taken from me twice, and I lift. Okay? So it doesn't interfere with me lifting at all.
Okay.
Okay?
Do you even lift, bro?
Yeah, I know.
Because I don't think so.
There it is.
Did you know that gut feeling, that voice in your head? Did you get, did you get that when he said he lifts?
Absolutely.
Yeah. Like, you don't
100%.
buy it.
No.
Oh, you bought it?
I buy it, yeah.
Oh, because the voice in me just said, I don't buy that.
Do not agree. If you agree one friggin' thing that he says, you're out.
Not saying a word.
All right, so we need to work on your septum and try to move it somehow straight. No matter how good it looks after surgery, even if it's 85% better, max. You still could have some deviation. You are gonna have a risk for what we call a septal perforation, a hole in your septum. If that happens during me trying to lift up the tissue, which is stuck to that traumatized, scarred up septum, we'll take some of the covering from the rib and put it where that little hole is. So this is a big 6-7 hour surgery.
My flight was shorter than that, so I'm pretty nervous for this. But at the same time, I trust him because everything's on the table and he's not hiding anything. My gut's just basically telling me I have to do this. If I want to be able to breathe normally, I just kind of have to muscle through it.
Let's do this.
Let's make it happen.
Yeah.
Pleasure.
Pleasure meeting you.
Thank you.
I'm glad you brought
Likewise.
me here.
Thank
Yeah.
you.
A good time. We'll take care.
Thank you.
Thanks, guys.
I appreciate it. A lot to take in.
Shit, that's gonna be a lot of recovery.
Do you feel me? Feel me? I'm out here living, baby. Out here living. I'm on the go. Like whoa, whoa, whoa. I'm on the go.
Oh, you're here.
Well, I mean, it's kind of too late to get up and run now, don't you think?
Well, no.
I mean,
What do you
never
mean?
too late. I mean, I gotta get the IV in. It's gonna be a whole hassle to take it out and book it, so I guess I'm kind of here.
I want to know what's your gut telling you. Like,
Still pretty nervous, but the way you laid everything out for me and kind of just was straight with me, told me it's gonna be a hard case. I got complete faith in you.
so let's get it done.
Let's do this.
What makes Xaverie's nose really hard is the degree of crookedness. It's extraordinary. I know I'm not going to get it 100% straight. If I can get 85%, I'm happy. Today for Xaverie's surgery, I'll begin by opening his nose while Dr. Frederick harvests rib. Next, I will use a mallet to remove the septal crest, which will make it easier to straighten and then perform a septoplasty to improve his breathing. Then I will insert a series of spreader grafts to push out the collapsed right side and correct the curvature of his nasal bones. Finally, I'll use articulating rim grafts to make his nostrils more symmetric. Okay, you ready? All right, so we're making the incision. All right, I'm going to dissect here in this direction. Remember, this is the third surgery, so we have to expect some scar here, right? So I really need to be careful here. I don't want to get through the skin. So even this is stuck like cement. Ah, shit. Hold on, we got a hole. Wait, just hold on. Give me caudal quick. Hurry up, I want to make sure I don't get this bigger. Performing revision septoplasty is very difficult. With Xaverie, lifting up that tissue, there wasn't any give, and it just popped open, creating a full thickness hole, which communicates from the right nostril to the left nostril. So when this happens, our goal is to actually put tissue in there, and God willing, it heals without creating what we call a septal perforation. So that's the rib coming out. Ah, I think I'm getting more movement.
Mallet.
Go. Okay. Wow, this is a hard septum.
All that work for the...
Well, no, I'm not finished. Section. The previous surgeon left bone, and another piece of bone called the maxillary crest, which resides on the bottom part of the septum. So we take a mallet and something called an osteotome, and we chisel it out, like I want to do to Terry's nose. I just want to chisel that whole ugly, long thing out. God, his nose is ugly. Easy. Go. There's cartilage that was pushing onto the left side. Down there was close to his rib yet, or?
Oh, his rib's great.
I want to put like the length on the rib.
Yeah, along the septum.
I mean, that long almost. So
Yeah.
I want, but I need two straight pieces.
So this is bending a bit.
Okay, I have another idea. What happens if you cut it this way now for this? In general, the older the cartilage is, it stays straight. Younger cartilage does not have calcification. It can curve easily. And that's exactly what's happening in Xaverie's young cartilage. Now, let's use that to our advantage. We're going to take the opposite side of the curve, fixate it to the septum, and that's going to help pull that curve from the opposite way over to the midline to get the septum straight. I'm a genius. I'm a friggin' genius. You want to see what it looks like or what?
Yeah, it looks straight.
Wow, look at the base.
Okay, the septum I like.
Yeah, septum's good.
You need a small rim graft in here, and that's gonna fill it and even push it over a little bit.
Yes.
Thank you, guys. So that was hard. Kind of. Actually, wait a minute, let me retract that. It was a little bit easier than I thought it was gonna be. I was kind of worried about this procedure, but I can tell you that it ended up being a lot better than I thought. The chance of Xaverie's nose becoming a little crooked to the left with cartilage memory still, probably about 10%.
Ah, it's Sweet and Xaverie. Has anyone ever made that joke?
Yeah, don't make me laugh, man.
Oh, look at it. Look, oh.
Sorry.
You doing okay, buddy?
I'm good.
I saw you got that going on.
Oh, yeah.
A little bit of pain?
A little bit, yeah.
How much pain?
It was pretty bad at first, but it's only got better, so.
Make sure you are doing some deep breathing exercises and still walk around and stuff, you know.
For sure.
Let me look. Just take one side.
All right, let's do this side.
Oh, let me look. Okay, put your head back. So, all right. Sorry. Okay, I'm just opening your nostril.
Yeah.
It hurts that much, huh? Okay, you know, we all get a little wimpy when it comes to this stuff.
Since the surgery, Xaverie's been a little bit of a pain in the tuchus. So, you know, it's different for women, I guess. Maybe we have a higher pain tolerance, and for him, not so much.
At this point, I see about a good 85% correction.
That's awesome.
Those splints are going to be there 1 or 2 weeks, but once it comes out, you'll be able to breathe.
Okay.
A lot better. Now you just got to heal well and take care of yourself.
No problem.
All right?
Yes, sir.
You're a genius.
Yeah, I'll give you that. I'll give you the title of genius. The fact that you can correct this, it's been years since I've had a straight septum and I've been able to breathe, so this feels like a miracle, honestly.
All right, brother. I'll see you later on.
Take it easy, thank you.
Likewise, thank you so much.
Looking back on where I was before with 2 failed surgeries and 20 injections in my face, to finally have the result that I wanted, it doesn't feel real. For 6-7 years, I had a messed up nose, and I am so grateful that I have a nose that functions and looks good. Catching my reflection at home, in the gym, no matter where I am, in a car window even, it's nice to see a nose that's not off to the side. It's a big difference. Dr. Nassif achieved around 90% straightness. Honestly, compared to how it was, this is amazing, and my quality of life has improved an insane amount.
You can just hear you breathing all the time. Like,
oh, yeah.
Like Tony Soprano. Dr. Nassif gave me the nose that I had at the beginning and better, honestly. Yeah. It actually looks better than before you broke it. Oh, 100%.
You're almost
way
handsome.
Better. Yeah. Almost handsome. That's your nickname. That's almost handsome. Almost handsome. I'll take it.
You have the body already, you know.
Appreciate you, Max. You got the nose to match. His nose was always just sideways, and now it's like a completely different person. He looks like a movie star.
He's been looking at himself way too much.
Now that we can't call you Picasso, what fits you? Make-A-Wish Wolverine?
My friends are still trying to give me a hard time, but it doesn't hit nearly as hard now that the nose can't be made fun of, so yeah. I could definitely say goodbye to the Picasso nose.
I gotta pick things about your personality. That'll be tough. I don't have one of those.
I don't think a doctor can fix that one.
From this experience, I learned to just definitely go with my gut. That's a huge thing for me. Walking out of that last surgery with that doctor who I did not trust whatsoever led me into Dr. Nassif's office, so everything worked out.
All right, let me show you a patient.
Yeah.
Now, when I show you Lori here, you're going to look at her and you're probably going to guess exactly what's going on.
Columella's gone. This looks like that absorption disease, that vasculitis thing.
Yeah, granulomatosis with polyangiitis. She got that sunken in look. You know, it's eating away all the cartilage. So she's got a problem.
My name is Lori, and an autoimmune disease ate away my nose. I've had 2 surgeries, and now my nose looks like it's sinking into my face. I try to avoid looking in the mirror. Makeup can't make this look better, so why bother putting it on? Nobody's nose is supposed to be that short and upturned.
That would look good on you.
I don't know why I try stuff on and look at it. I'm not gonna wear it anywhere.
That's something I wish would change. I wish you were more confident.
I hate my nose.
I know.
It just doesn't look right. I don't go out very often, but my mom knows if she calls to go antique shopping, it's the one way to make sure I get out of the house and do something. I'm just very uncomfortable in my own skin anymore. My condition attacks any organ in your body as if it were a foreign disease.
I just wish you saw yourself as I see you.
Around 2006, my nose slowly started to fall down. I was starting to get saddle nose deformity. So my doctors decided to send me to an ENT that could do reconstruction work on my nose. I lost all my confidence. I don't date. I'm terrified of everything. All I want now is to not be noticed. I just don't want to stand out anymore.
I want you to be happy.
I know.
I want you to have the life you deserved. You should have had a long time ago.
I just want to be comfortable when I look in the mirror. That's all.
Lori, Nice to meet you, Dr. Nassif.
Hi, Lori. Terry Dubrow. Pleasure to meet you.
Is this your mom?
Yes, my name is Lori as well.
Oh,
hi,
that'll be
Lori.
easy today.
Terry Dubrow, nice to meet you. So it's not very common, in my experience anyway, to have a daughter who's named after the mother. How did that happen?
Her father named her. Yeah.
I can see when it's the same sex, but I guess if your child was a different sex than you and you still named your child after you, and his daughter's name is Paulina, one of your kids' middle name is Paul?
Two of them, Gavin Paul and Christian Paul.
Oh, okay.
I want to have my legacy with my name on my kids. Like you, for example, you know, you're my buddy. I think what I want to try to do is change your name to Dr. Paul Dubrow.
Paul Dubrow.
What about a middle name?
No.
Take us back from the beginning.
Okay. I was in college. I would have joint pain move from one knee to the other, from my ankle, elbow, my thumbs. The doctors brought in a pulmonologist at the hospital, and he decided to do a chest x-ray. And he saw a speck on my lungs. And when it came back, I had granulomatosis.
Granulomatosis with polyangiitis is inflammation of the blood vessels. Now, we can start with joint pain and sinus pressure, and then the later on symptoms are usually the nasal problems, especially a large septal perforation.
When did you first notice changes to your nose?
2006, I think I started noticing my glasses falling on my face a little bit. And I'm like, well, that's strange. So I asked a rheumatologist, and they were like, oh yeah, you're getting saddle nose. It's gonna start going. And then there was also a point where I started smelling something. Started smelling garbage around the house. Just talking to her from here, she could smell my nose.
Oh my God.
When you have granulomatosis with polyangiitis, it eats away the cartilage. It eats away your nasal septum. That smells. And I'm sure that garbage you smelled was her tissue basically rotting away. So then what happened?
The doctors took the top layer of my skull and formed a bridge right here, and they took some cartilage from my rib and put it in there, and it looked great. And then I started noticing it was getting gray. I could lift this piece of my nose, the ball, off.
And the skin had separated.
And I freaked out.
Yeah, you had some necrosis and breakdown.
So I went in for the second surgery. He did get it to connect, but he said that that was the best he could do for now.
Since then, have your health been stable and everything else?
No, it has not. In 2014, I got H1N1.
Oh my God.
Because I am immunocompromised. I went into the hospital. They induced me in a coma right then and there.
Did they intubate you? Did they intubate her?
They told us that she's lucky if she has a 50% chance of living. She needed a lung transplant. Got a call and said they found a set of lungs.
You got a lung transplant?
I got a lung transplant.
A double lung transplant.
Swine flu killed your lungs.
And I have since been in remission for 12 years.
You've been in remission with that, so that's the key I need to hear.
Yes.
That you have had no flare-ups for 12 years.
For 12 years, I've had no flares of white.
So let me ask you about your nose then.
Yeah.
So in the last 12 years, have you noticed this, again, shrink wrap?
No.
So it's stabilized.
How much do you think the nose affects you now that you're healthy?
I still feel like people stare at me. I've become almost like a recluse.
She does.
I don't go out and do anything.
She stopped going out.
So basically, you're here for me for the aesthetic aspect of your nose. So what do you want?
A nose that looks normal. Something that doesn't make people go, something's wrong. The best you can do with what you've got to work with.
Hello.
Hello.
All righty. I'm gonna take a little exam of your nose here.
Okay.
First of all, let's feel. So the skin here doesn't have a lot of flexibility this way, right over the bridge here. Now let's feel this. Okay, we have a little mobility. Oh yeah.
Let me see. Whoa.
It's one big hole. So yeah, you have no more cartilage at all. So this is just kind of free floating now. All righty. We need cartilage. Obviously, with you having bilateral lung transplants and then working on your ribs, I don't even want to take a chance on using that. So one thing we'd have to find is cadaver rib.
Okay.
We're using cadaver rib because Lori had a double lung transplant from the swine flu, which means most likely she has calcification or hardening of the ribs. It's just not going to be usable for us. Our biggest thing right now is trying to build up this
Right.
a little bit more and make it more even because it's caved in on the right side. That we can do with cartilage.
Okay.
If your skin's gonna stretch. But the most important part for you is this look right here.
Right.
So our goal would be lowering this part right here called the columella. The question now is preventing necrosis or skin death. And that's one of the parts that I'm unsure about. Because one of the things that we have to do, like the previous doctor did, is make an incision, lift up the skin to be able to expose it so we can put in our cartilage and work on extending your nose.
Okay.
So no way to do it closed?
So he just asked me a question. Can I extend this whole thing from making incisions inside the nose with enough visibility? I don't know. I'm gonna think about that.
You would probably start there.
And that's to save it so it doesn't die.
That's right.
Yes.
Okay.
Because it can't die if you don't cut through it.
That's if you decide you want to even do this.
Yeah. Okay.
What are the risks? Risk is I don't improve this, or only very little. So what do you think?
What do you think?
And Mom, what do you think?
The decision has to be hers. I want her to be the Lori she used to be a long time ago. I just want her to be happy with the way she looks.
I say yes.
Whoa.
Let's try.
That was fast.
Yes.
Just like that, I
Yes.
thought you were gonna pause, and didn't you think she was gonna hesitate?
No, because she hates the way it looks.
I have so much faith in you. I'm excited, and I can't thank you enough for taking a chance on me.
It's a pleasure.
Thank you.
Good morning.
Good morning. I have surgery today with Dr. Nassif.
Okay, great. You can go ahead and grab a seat.
Thank
you.
Thanks.
How are you feeling?
I'm ready, but I'm excited.
Be good.
Yeah.
Be good. Okay. Lori struggled for many years with a couple different illnesses, with the lung transplant. I believe she deserves some happiness now.
Good morning. How are you, Lori?
Good.
You know Dr. Ping, of course.
Hi.
Are we ready to have fun?
Yes.
So we talked about going closed first, which means no incision here, leaving the scar tissue alone. It's the safest way. However, if we feel limited, we're gonna have to cut in the area of the scar and lift up the skin, all right?
Thank you
Our
so
pleasure.
much. I'm
All
so
right.
excited.
We'll take
We'll
good
see
care
you.
of you.
All right.
Lori has a risk of tissue necrosis, which means tissue death. That's probably the biggest fear, followed by an infection because she's immunocompromised. Today for Lori's surgery, we're going to attempt a closed rhinoplasty, so I will start by opening up the side walls of the nose to try and get mobility. Then Dr. Peng will make grafts from the cadaver rib cartilage. I will insert a diced cartilage glue graft along the tip to add length. I'll add alar batten grafts to open the nostrils and a columellar plumping graft to give Lori a more projected and rotated nose. You know what I'm gonna do? I'm gonna just kind of open up the side wall of the nose. I want to get complete mobility. I want to kind of just see where we get. The limiting factor of this procedure is going to be how much can I mobilize the skin. It's the amount of skin stretch, which will then give us more of a lower nose, more of a normal look, and not the pushed up nose appearance that Lori has now. So this is going to be a very important area here. Ah, shit.
Small little area of very, very thin skin. Very thin skin on the left mid-nasal sidewall.
Yeah, we're kind of free.
Looks pretty good.
Yeah, we got some mobility. Now that I've mobilized Lori's tissue in her nose, that means I can lower her nose. Now, how much? I'm not sure yet. Why can't we make a DCGG that extends all the way here, like this, fill this, and leave this alone?
Yeah, we can. Let me go carve the rib.
Well, that's a nice piece of cadaver rib.
I know.
Oh, yeah. If we can do this without opening up the nose, that is such a huge friggin' win. God, am I getting excited right now. All right, let's irrigate. With Lori's disease, polyangiitis granulomatosis, it's almost a self-eating disease that eats the cartilage of the nose. So cadaver rib, it's not her cartilage, it's already been irradiated, so I don't think her body's gonna reject it, but only time will tell. Okay, so we're putting the first one. These are to open up her airway.
Why don't we take one of these and cut it in half?
All right.
Probably mellow.
You got that? You did a very complex surgery through a closed approach. I have never attempted or used that many grafts in a nose through a closed rhinoplasty to help lengthen a nose. However, due to the limited stretch of her skin, the inability of her skin to move with all those grafts, yes, our results can be limited, but I think in the long run, she's gonna have a nice improvement. All right, that's pretty damn good.
It don't get better than this. Can you work with it? It don't get better than this.
Hey, how are you?
Hello, hello.
How are you?
How you doing?
I'm good.
How do you feel?
Great. No pain.
Really?
Yeah.
So, when we got in the operating room, I made my incisions to do a closed procedure. I was very happy with the augmentation. I even dropped the tip. I got you lower, and I was happy. Now, could I have got you a lot lower? Possibly. But the problem with that would mean I'd have to cut this open, take a composite graft, which might die, and then we lose everything.
Yeah, not worth it.
You know. Right. So it wasn't worth it at that point, obviously.
There are two reasons why it's really good that Paul was able to do this surgery closed. One, he didn't have to make any incisions which would impair the blood supply and lead to potential for non-healing. And two, I made the suggestion. Isn't that awesome?
Well, let's just take a peek. Look at, of course, nice and clean. I'm looking at the health. It looks fine.
Yeah.
Now, your profile is going to drop. I extended that implant all the way down to the tip of your nose.
Okay. It looks wonderful.
No pain, right?
Mm-mm.
As Lori starts to heal, I'm going to start having her doing nasal stretching exercises, basically pulling the tip down. I wish I could have stretched her nose more. However, in the coming time, even up to a year to 2 years, her nose will lengthen more. And I would hope to see that she is going to actually lengthen 10 to 15%. So if she's happy now, she'll be ecstatic later.
It looks real
Yeah,
again.
no, it
It's
does.
not like small and crooked
Yeah,
and
no, it's
shrivelly. I love it.
I love
Thank
it.
you, guys. Having a natural looking nose has not only given me confidence, but it makes me feel secure, and I no longer avoid looking in the mirror. Hi.
What can I get for you?
Something to celebrate.
All right. Think I got something for you?
I feel that the old Lori's coming out, and the longer time goes on, eventually the old Lori's just gonna burst through. Just puts a smile on my face all day long. It's been 3 months since my surgery. It could take up to 2 years for it to be settled, but it is forming downward like it's supposed to, and that's just thrilling. A lot more fun to come out and people aren't staring at you for the wrong reasons.
You look beautiful, Lori.
Before my surgery, an autoimmune disease had completely destroyed my nose. After 2 failed surgeries, my bridge was short, my nostrils were front and center, and people stared at me everywhere I went. But now, thanks to Dr. Nassif, my bridge is longer, my nostrils are less visible, and I don't get stared at when I go out in public any longer. Now, I only stand out when I want to. I've been going out a lot lately with my friends and doing things a lot more, and I think it's just gonna get better.
This surgery has changed Lori's life. I see more confidence in her. She's smiling, she's more bubbly. You could do anything you want now.
Dr. Nassif has put the biggest smile on my face. There isn't a day I don't wake up grateful. This nightmare is over, and I can enjoy my health and count my blessings. There's nothing to hold me back, no excuses anymore.
I'm gonna hold you to it.
When was the last time you traveled to London?
I was in London about 4 years ago. Why, we have a patient from London?
We have a patient from London. You ready for this?
Oh,
look at that. Meet Demi Moore.
Demi Moore?
Yeah.
Like
Demi Moore.
Like
Demi Moore.
Is that a real name?
I have no clue.
Is this fixable?
My name is Demi and my nose looks fucked. I feel I look horrific. My nose looks concave, crinkly. I look like a character from Avatar. I feel ugly and it makes me feel so unhappy.
Can I have 2 soda waters, please?
Absolutely. Hi.
Hi, you're here.
Yes.
Nice to see you.
Hey, nice to see you. How you doing?
You look very nice.
So do you in your nice red dress?
Thank you.
When I was growing up, my nose just looked normal, but over the years, my nose started to fall apart. In 2010, I decided I needed to have my nose fixed, so I had surgery, but it didn't work. And then 3 weeks after my surgery, my nose was collapsing. Now, I have difficulty breathing when I'm sleeping. I breathe from my mouth, wakes me up throughout the whole night, so I'm not even sleeping properly because of my nose.
And do you miss the company of a man?
Well, I don't know now, because I've forgotten.
Who would you like to date?
Someone nice. Someone tall, dark and handsome.
Tall, dark and handsome.
Nice body.
Nice body.
Nice height.
Yeah.
Even though I'm short.
Nice package.
Nice package. Re-up. The last time I actually went on a date or had a boyfriend was about 7 years ago. And I wouldn't even like to have sex with somebody with my nose looking like this. You know, I'm finally ready.
Yeah.
To move forward with my life.
Fantastic.
And meet somebody.
Yeah.
And to be happy.
Can I just say,
Yes.
Demi, that I loved you in Ghost, seriously.
Do you know what? I was just waiting for someone to say it.
So how did you arrive at that name?
So my name is Dimitra, so we've shortened it to Demi.
Dimitra.
And then my ex-partner was Moore, and my real name is Papadopoulos.
That's a great conversation starter for
It
us.
is. They go, I can't wait to meet you, Demi. I'm like, yeah, here we go.
Yeah.
Don't get too excited. But yeah.
Yes.
But let's talk. Dr. Dubrow and I were perusing your photos.
Yeah.
When we see a nose like yours,
yes,
it usually means that someone has had autoimmune disease where things are kind of eaten away.
Yes.
Or a lot of trauma, or on the other hand, a lot of use of cocaine. Can you tell us which one or combo of those?
Yes. So I used to go out,
Okay.
drink, party a bit.
All right.
Party.
yeah,
What does
yeah.
party mean?
Drinking and taking drugs.
Doing a little bit of drugs.
Cocaine.
Yeah.
You mean cocaine?
Yeah, I do.
A bit.
A little bit, yeah.
A little bit.
Well, a
Well,
bit.
maybe a lot.
Yeah, but it became a habit.
It became a habit
Yeah.
when I went out. In my 30s, I split up with my partner. So I was going out a lot more, partying 24/7, doing cocaine, 1/2 gram a night, maybe 1 gram sometimes, obviously way too much. I was too busy having more lines, doing more drugs, getting more drunk, partying all the time, that I didn't even notice what was going on with my nose.
When was the last time that you did cocaine?
It was about 1.5 years ago.
Okay.
How many years of cocaine were you doing?
I was doing it for about 10 years.
10 years?
Not every day, I was doing cocaine though.
But
Yeah.
continuous use for 10 years.
Yeah, I did have a break of maybe a year when I had my nose job.
And what was that surgery for? Was your nose like this at all?
Yes. When I had surgery, I said, what are you going to do? It was a consultation over the phone. And he said to me he's going to take a bone out. He
So
knew
the
it.
nose had been collapsing.
Yes.
And he was trying to reconstruct that.
Yeah.
But then when I come round and I didn't have any pain, I knew I was meant to have pain because they took my rib. I asked him, did you take the rib? And he said no. And I said, why? He said, well, I didn't need to.
What did the nose look like after surgery? What was different?
It looked like it was lifted here.
Yeah, just slightly looked like it was.
Did they use ears?
Nothing. They used nothing.
What did they do?
I don't know what.
Because you need something. So did you ask the doctor what you built this up with?
No.
Okay, you didn't.
All he advised me he would do for me is would put filler in it.
Is that what happened?
Yeah.
Yeah, she done.
So you have filler in your nose?
I had filler after.
Yeah, quite a lot. She's
I've had quite a lot.
When you've had previous surgeries and you try to inject a filler, it can compress a blood vessel and kill the skin, just like it did with Demi, her whole left side. But in general, you need to be careful when injecting anything in the nose, even a virgin nose that has never been operated on.
How did you stop cocaine altogether?
I just had enough of it. People think, oh, Demi's great. Demi's like life and soul party, and I am.
Right. Because you're on a lot of cocaine.
Well, no, yeah, but no.
In that
Even so, I'm still like the life
Well,
and
now
soul.
you still are. You got a lot
That's
of
what
energy.
I'm saying. I am.
Yeah,
This is
she's
how I
very
am.
bubbly.
I'm always like this.
So do you think this is it for you?
Absolutely.
Yeah. I think she's much stronger now. She won't return to taking drugs. I really do.
I've stopped smoking. I don't drink so much now, and I've stopped cocaine. Now is the time to wake up and start living.
So you're here for a reason, obviously.
I am. Anything you can do to even straighten and lift my nostril. I'm not asking for a beautiful nose. I know it's not going to look amazing. I can see what it is.
What we need to do is I need to examine your nose. And I need to dissolve your filler.
Yep.
I need to look inside that left nostril. I need to look at that crease because I'm not sure if I can do anything.
All right, Demi, I'm just gonna put numbing cream on your nose here. Okay, we'll leave that on for a few minutes.
Hi, Laura.
Hello.
How are you?
Hi, good, how
Hello.
are you? Hello.
Okay, good, you numbed her up. All
Yeah.
right.
Yep.
So I just want to feel your nose better.
Okay.
Okay? Laura, can you give me a Q-tip?
Yep.
This is bright. Can you put your head back for me?
Yeah.
Wow, that's collapsed.
Let me look inside to see how big that hole is. Oh my God, you have no airway at all.
Oh.
Jesus, there's no airway. Now here's the most important thing for me.
Whoa.
Let's see, you ready?
That's really deep, isn't it?
Well, this skin's gonna probably pop open. All right, so the left side, it does open up.
Right.
However, the tissue is wafer thin, which makes it dangerous to try to insert a piece of cartilage in there, assuming that I could try to make a pocket in that without ripping right through the skin. So, my goal is to try to give you some improvement.
Absolutely.
Whether it's 20% versus 50, but max out on 50.
Yep.
Right.
What is the risk? I can kill your whole tip because you need an open rhinoplasty. I have to make a little cut here, lift up your skin, but because of the poor blood supply, it may die.
I'm happy to go ahead and do anything that will help and improve me. So I trust you.
Take the risk.
I know that Laura's going to do some dissolving.
Yeah.
I have some patience.
Okay.
It's been a great pleasure to
And
meet
you.
you.
And you.
So I will see you very
much.
soon.
Thank
Yes,
you.
can't
Good luck with
wait.
your
Thank
thing.
you
Thank
so
you.
much.
Prior to any surgery, if a patient has had fill in the nose, the smart thing to do is dissolve the filler. And that's exactly what Laura's gonna do. However, I've been in the noses before where patients have not told me they had filler. It makes the dissection harder, it makes the surgery more difficult.
Our great distractor.
This is a distractor, is it?
Yep.
I'd rather have Brad Pitt.
We don't have that on hand today.
No.
So 1, 2, 3. Good. Good, nice slow breathing.
All I can think of is, fuck, this, It's a very small price to pay knowing that I'm gonna get the help from the amazing, super Dr. Nassif.
3,
1.
1. There you go.
I think that.
Good job, Demi.
Thank you.
Yes, you did it.
Yeah.
I gotta tell you,
Hey,
I'm
Better-
good.
badass.
better you than me.
I'm here to see Dr. Nassif for my rhinoplasty today.
God damn.
How exciting.
All right, Demi, are you ready to head back?
I certainly am.
All right, right this way.
Let's go to break. I'll see you later.
I love you.
Love you too.
Oh, good luck, Dem. I hope it's going to be good. It will be good.
See you later.
See you later.
Bye.
Right this way.
Thank you.
Of course.
I can't wait to see this new nose. I've been looking at her nose now for over 12 years. It looks awful, and I think it's going to be a great improvement. I can't wait. I'm so excited.
So this is gonna be a challenging surgery. The years of cocaine use has damaged everything. From the outside to the ridging on her skin, in addition to that nostril on the left. And to try to elevate that skin and open it, that's gonna be tough. Today for Demi's surgery, Dr. Frederick will harvest rib while I open the nose and assess the internal damage. I will then remove any residual filler and scar tissue that I find along her dorsum. Next, I will insert a columellar strut in the midline of her nose, which will keep her nose straight and stable. Then I'll use diced cartilage glue grafts to give her projection and build up the dorsum. And an alar batten graft and rim graft to build out her left nostril. Finally, I'll insert an infra tip graft to the tip to enhance her tip projection. So I'm gonna just start by opening the nose. I need to go from this side, from the right side to the left, because I can't even see. Trying to do something I really haven't done before, going just from one side of the nose to try to open up without really touching the columella. Okay. Scissors. Okay.
Yeah, you got it. I never doubted it.
Woo!
Yeah.
Filler caused a lot of problems. So here, this was what was on top of the dorsum, this gel stuff that we felt. It's like a weird rubbery scar. And that might be from all that filler she's had. What I found in Demi's nose is a combination of filler and scar tissue all combined into one. But my goal is to clean everything out so I can have a nice clean pocket so I can try to rebuild Demi's nose. What's going on with you, Dr. Frederick?
I'm going to finish freeing this surface right here.
Oh, you did it. Here comes the rib coming out. Pour it in here. I want to see if I can use the big rib. Let's play with this first. There's media crura and dome, I think, and that's it. All the cartilage here is gone. So, John, do you have something kind of straight I can put in the midline?
Here's what we got so far.
Those are good.
Yeah, these are all really good. I got them different widths.
Let me take this one.
Yeah, that's a good one.
All right, let's put it in here.
Look at that, perfectly curved.
I mean, we won't be able to even fixate this to bone. When you have a nose like Demi's, you need to use everything in your armamentarium to build up her nose. So I need to use all types of grafts. We need to build up her dorsum. We need to actually try to build up her tip and give it support. And we need to build out the complete left tip. That is using a lot of grafts. All right. I mean, that columella is probably about as best as you're gonna get.
It already looks so much better though.
Oh yeah, she has a nose now. I mean, listen, this is about as much as she can get, which is still gonna make a huge difference in her life. Well, I like the way this table's set up this way.
How are you?
How are you? How are you?
I'm good.
How are you?
I'm good, thank you. You?
You know this guy?
We met
Dr. Frederick?
Yes. Okay.
Yeah.
Is that something on her tip right now? Is there some nitro paste or
There's a
something?
little bit of nitro paste on there.
They put that on
Okay,
there.
well, let me look at you first.
Yes.
Just hold it just like that. Actually, her tip is not that purple.
Yeah, it's just a little.
Since the color of her skin was pretty good following surgery, I feel that this purple color is something that's temporary and she should be fine.
Good job.
Good job. What do you mean
Amazing.
good? What the heck? Jesus.
Amazing job, man.
Ya Allah.
The best job in the world.
Best ever.
So, here, let's put this back on. So, your nose was hard.
Was it?
Of course,
That's
expected.
nice, yeah.
But I was pleasantly surprised.
Oh, really?
We're able to actually build up everything. We added cartilage everywhere.
Brilliant.
So at this point, I'm ecstatic.
Yeah, and me. Listen.
And you're gonna be able to breathe beautifully on that left. Now, so that means life goes back to normal.
Absolutely.
No cocaine, of course. No blow.
Not.
Okay,
Ever.
none of that.
No. I'm not going back to the way I was. I've changed my life. I look at myself and thinking, oh my God, is that you, Demi? You know, it makes such a difference. I feel so much happier. I'm overjoyed, overwhelmed. I cannot believe it.
Goodbye, darling.
Thank you so much, darling. Thank you.
Bye, Paul. Bye.
Everybody wants to crash our party. That's alright if you don't mind acting a fool.
Looking back after everything I went through to get this nose, I feel like a new, fabulous superwoman. I look at my life in a completely different way. I feel healthier, younger. I feel free.
Hi. How are you? Good. How are you?
Yeah, really good.
Oh, thanks for meeting up.
Oh my God. Dr. Nassif is a miracle worker. He's amazing. He has saved my life, and I truly mean that. Before surgery with Dr. Nassif, My nose looked disgusting. The definition from a side angle was just flat. You couldn't see nostrils or anything. But now, my nose is amazing. I can breathe, I can sleep, I don't snore. Oh yes, I'm like a little princess. And now I've got this beautiful nose by Dr. Nassif. I'm sure I'll meet the man of my dreams.
Well, you look great.
Thank you. I mean, I can't stop smiling. It's like changed my life.
Yeah, it has. Would you want to meet someone? Have you thought about meeting someone?
So I'm ready now.
Yeah,
I'd like to meet
great.
somebody.
I'd love
Do you
to
know what I
see
mean?
you with someone.
I know, it would be nice.
Yeah.
I will never touch cocaine again. Dr. Nassif has done an amazing job on my nose. It's like so precious now. I guard it with my life. I feel amazing. Hi.
Oh, look at you.
Check him out. He's cute, isn't he? Did you see the way he checked me out?
Yeah.
Oh my God. I had to do a double take. I thought, was he looking at me? And he was.
Just trying to be posh. Don't be posh, just be yourself.
I
I have a patient that you know.
Oh, really?
This patient we operated on 5 years ago. He kind of forgot his post-op checks and hasn't seen you in a while.
I think I remember this one.
Nate.
5 years ago, Dr. Dubrow and Dr. Nassif came to my home and gave me a consultation.
Nate has a identical twin brother, but he does not look like his identical twin brother. When they're in utero, I think it's called twin-to-twin transfusion. It's a disease that the placenta cuts off the blood supply to one of the twins.
I was born with a club foot, a hole in my heart. My eyes were pretty far separated and basically looked like I had two noses. I had 21 surgeries total. So I had surgery with Dr. Nassif. My nose was looking great. It had a nice profile. I had a tip that I never had before. My nose was symmetric, and going out in public, I had no worries at all. But going into the third year after my surgery, I started noticing the changes. I still get asked what's wrong with me. It gets me down. I would like to have a point where I don't have to deal with that no more. I think missing that 2-year appointment was a lot of a bigger problem to me than I originally thought it would be.
And then your snoring's gotten extremely bad.
Now is the right time to see him and try and get my issues fixed before it's too late.
Nate!
Long time no see.
Hey, Nate, been a while.
How are you?
Good to see
Pretty
you.
good.
Have a seat. God, it's great to have you come in.
The first time we met, we didn't see you here. We saw you where you live.
So over 5 years ago, we did a few things. I mean, you look pretty darn great.
Yeah, so tell us, you were pretty happy with the results of all that?
I was happy. And
I was happy.
I did notice after a couple years, the tip caved in and my breathing started getting really bad on my right side, and my left side started to bulge out more, and my left side drooped a little.
What's going on with the breathing? Is it affecting your life at all?
Affecting my exercise activities, going up and down the stairs.
I know the breathing is a big issue.
Yeah.
Sleeping's hard at night.
You should hear me snore, apparently.
From the cosmetic side, what would you love to see?
I was hoping to try and fix the tip and then see if we can narrow my nose a little bit on the left side.
Due to Nate's condition when he was born, there is no way to achieve 100% symmetry. As a matter of fact, no nose we can achieve 100% symmetry. It really depends on that examination, because I'm not sure, especially because of the risks of skin death, if I can do anything. Let me get my speculum. I want to look at everything. Put your head back just a little bit for me. A little bit more. All right, good. All right. Looks pretty good. Okay. Breathe in now. Again. On his left side, Nate has some fullness. On the more normal looking side, the right side, it looks pretty good, but the nose is collapsed. He can't breathe. His airway overall is just very small. And that's the question, is how can I make his nostrils wider? So let's just talk first of all about some of that fullness. So this fullness, that's that big piece of cartilage I put in to keep your nose open on that side. And it's usually in a direction like that, but it migrated more up. And then right above it here, you have a little depression. So lower, fullness, depression, dip, and then skin irregularities. And then on this side, we have a small airway. Now, when I go in like this, breathe, your breathing's better.
Yeah.
So we have two issues going on for your nose, cosmetic and functional. The functional side, our goal would be to go in there and open it up for you and possibly add some cartilage that's going to open up your airway. I think some of that cartilage inside your nose might have even calcified, and that's what's caused that fullness. 5 years ago when we operated on Nate, he had a partially calcified rib, which basically means unusable. So this time what we're going to do is use cadaver cartilage, which we know is not calcified, and a Dice cartilage glue graft. I really want to try to do your surgery through a closed approach, which means incisions only inside your nose, because what I'm worried about, this being your 5th rhinoplasty, if I make that cut again, your whole tip could die. So what do you think about what I said?
I mean, I feel if you're confident enough to want to work on me, then I'd feel confident about it.
I'm in. All right.
Alrighty.
It's great seeing you.
Oh, yeah.
I mean, listen, I got to tell you, more than anything,
You want to go back and milk some cows.
Checking in for surgery today. Getting prepped for surgery these past few days and just getting mentally ready for this. It's been draining.
there he is, the man, the myth. All righty. We gonna have some fun?
I think you are.
All right. Well, you're gonna be kind of a little sleeping. Now, let's talk about a few things. So our goal is to open up your breathing, as we talked about. So cosmetic is secondary, function is number one for you.
Sounds good to me.
All right, brother, we'll take good care of you. Today for Nate's surgery, I will attempt to do a closed rhinoplasty by making incisions inside his nose. I'll remove the scar and the calcified rib from his previous procedure that is causing his nose to collapse, while Dr. Peng makes grafts from the cadaver cartilage. Then I'll use a Dice cartilage glue graft to build up his saddle nose deformity and give him more tip projection. All right, so let's see. I'm gonna feel how the scar is. This is gonna be interesting to see what we can get. See, here's the problem though. You're looking at this. We're not gonna have easy access, I don't think, but let's see. Well then, you know what? I'm wondering if I should cut it here. All right, let's see if I can do this somehow. I mean, this is gonna be tight.
I'll push it open.
I don't wanna give up yet. I'm gonna just see what I can feel. I don't know if I can do this. While performing the closed rhinoplasty, I just can't get the exposure that I need to give him a good result. We're going open. I'm not gonna be able to do the job I want at all. I need to do an open rhinoplasty. I need to make that incision on the columella, elevate the skin carefully, and then basically address this whole tip area so I can see what I'm doing. So what about this cut here, Grace? Look at. So we're trying to keep the skin as thick as possible.
How does it feel so far as you're cutting
It
through it?
doesn't feel horribly yet, but I'm glad we did this. Looking at this tissue, one, I hope he heals well. You know, we don't have any blood issues, because I can tell you now, he needs this approach. So on Nate's nose, one thing that I really want to be careful about is I do not want any vascular compromise. So I have to be very, very delicate, because the last thing we want to do is see his skin turn purple, which will limit the amount of oxygen going in, and that can kill the skin. The fullness we're seeing on the left side is this. This is a combination of scar tissue, but also our previous rib graft right here. Okay, ready, kids? Let's see what happens. That was a piece of cartilage, scar, everything. That's exactly where that fullness was. We pretty much debulked everything that was causing fullness intranasally. Scar, native cartilage, and we just removed it. Now we need to reconstruct Nate's nose the best we can using a Dice cartilage glue graft. It is cadaver rib cartilage diced up and mixed with fibrin glue. I will use it to build up Nate's nose and make it more symmetric. Let's see your tip. Bring it over. I want to kind of go, okay, let's start off with one.
No, we need like 3.
Let me see if we put too much in here.
I mean, it's definitely higher than it was.
The columnar skin is what's limiting our projection. However, saying that, he's gonna have a lot better result. All right, so we got the dorsum up, we got the tip up, and we should see if the leech lady is around. Well, great job, you can lower the table. Surgery went better than expected. Overall, functionally, aesthetically, much improved. Not perfect at all, by no means, but a lot better. We now have to watch the nose. He may need leeches. We have to see how his nose is gonna heal. How you doing, buddy?
Doing great.
Let me see, put your head back. Oh yeah. No leeches for you, my friend.
I was hoping to put a leech on his
I know. You don't need it though, your skin's looking too good. All right, I removed a lot of internal obstruction to help open up your airway better. How's your breathing right now?
I'd say it's pretty even on both sides.
But compared to pre-surgery?
Yeah, a lot better on the right side.
I feel like you really opened up both sides of your airway.
Nice.
But no matter what, heal from this, then you gotta have your follow-up.
It does look thinner and a little bit more symmetric, especially on the tip. I'm definitely looking forward to what the outcome's going to be after the healing process. I am definitely not missing any appointments with Dr. Nassif this time. Thank you
All
for
right,
working
brother.
on me
I'll
again.
see you later on.
I've had 25 surgeries due to my twin-to-twin transfusion, and this surgery was the most important one to me because it can give me the chance to finally close the chapter on this book and then just hopefully move on without having any more surgeries. My nose is the most normal looking it's ever been. Going out in public has been a lot easier for me now. I'm just a face in a crowd. I'm not the center of attention. It's nice not being stared at. You wanna come join me? It's nice to be able to breathe out here.
It's a nice day today.
It is a beautiful day today. 5 years ago, I loved the way my nose looked after Dr. Nassif operated on it, but then a few years after, my tip collapsed. My left side bulged out, I couldn't breathe very well, and my wife complained about my snoring. But now my nose is more symmetrical, I can breathe properly, and it just looks like an overall normal nose. And best yet, no more snoring, maybe a little. Very fortunate to have Dr. Nassif work on me again, give me a better looking nose, and going out in public and stuff's just a whole lot easier.
Give you that second chance.
Dr. Dubrow and Dr. Nassif, I just want to give you a sincere thank you from the bottom of my heart for giving me a second chance and working on my nose. You did a fantastic job. You exceeded my expectations. I'm super thrilled to have this nose for the rest of my life.
When is your next appointment with Nassif?
I got an appointment here in the next couple of months. I don't plan on missing any appointments this time around.
Good. Yeah, I don't think you're catching anything tonight. I think we can go out to dinner tonight.
Ouch.
The next patient we're seeing has basal cell, right?
Oh.
Yeah.
Oh yeah, if I were you, I'd be freaked out.
This is worse though, God bless her.
Gosh, she walks around like this.
My name is Shelley, and cancer has left me with a hole in the side of my nose. I'm forced to wear a silicone prosthetic. It's been a tough year. I've had 2 surgeries, one to remove the cancer, one to rebuild my upper lip and cheek area, and it looks like something out of a horror movie. The scar comes from all the way up in my corner of my eye and cheek, all the way down here, and the scar above my upper lip is really deep, and I don't like the way that it's healing.
I like playing here. Nice that they don't pair us up with anybody. I'm still not comfortable with new people.
It took me a while to leave the house, but I pulled up my big girl panties and just really pushed myself to get out there, even if it was just to go to the grocery store.
Nice shot.
Well, oh, there we go. Was it pretty?
Hey, it doesn't have to look pretty as long as it's there.
I actually got a mask that said under construction on the front of it and tried to make light of it as best I could.
I'm nervous going to see Dr. Nassif and Dr. Dubrow.
We've seen what they can do. Shelley and I have been through a number of consults, and the letdowns have been unbelievable. Whether they don't want to do it, they've never done it before, just stick with where you're at with the prosthetic, it's never going to get better.
I go in and they say they can't do it. Am I just stuck like this the rest of my life, you know?
Beautiful either way, babe.
Before I had cancer, I didn't have a perfect nose, but looking back, what I would give to have my old nose back. I just want to get that confidence back and just get back to living again.
Are we all tied up?
All tied up, babe. That's why I'm not giving you any more strokes.
Shelley, Dr. Nassif.
Terry Dubrow, pleasure.
Nassif, Brian
Pleasure.
Great to meet you. So where did you come in from?
Down in Fort Myers.
Beautiful golf over there.
Yeah.
Yeah.
Are you guys golfers?
Yes.
Oh, yeah. That's
Oh,
what
We're big
we
golfers.
do.
Uh-oh, here we go. All right, I'll come back in half an hour. If you really want to call what he does golfing,
Wait a minute.
you suck at golf.
No,
There,
I don't.
just said it.
Wait a minute. So you guys are couple golfers.
Yeah.
I got to get
We
my
do.
wife to do that.
Yeah,
now.
you
She's
should.
been married for how many years now? 4?
4 years.
So then you've been around for this.
I have.
Yes.
And by the way, we were looking at your photos and we saw the defect.
That's impressive.
And so
what's going on
that
there.
is pretty darn
Wow.
good. Is that a prosthesis or
Yes.
tape?
Yeah, it's a prosthesis. People don't realize that you don't just put on a prosthetic and leave it on and you go to sleep and you get up and it's there. You have to clean it multiple times per day, apply it, and all the steps of that. It could probably eat up at least an hour, if not an hour and a half.
So you had your basal cell, and I have too.
Okay.
And I had it in the same place as you,
Yeah.
but not like
As
this,
expensive.
obviously.
Yeah.
So tell us exactly what happened.
When I first noticed something was 2017, and I had just a little flaky spot on the side of my nose.
Okay.
And so I went to the dermatologist, and she decided to prescribe me this, it's kind of an immune response cream.
Yeah.
And it kind of seemingly went away.
Okay.
Fast forward 3 or 4 years later, I started noticing my nostril was collapsing a little bit, and then a mass starting right above my lip. And it came back as this morphiiform,
That's the
infiltrative.
rarest type of basal cell.
Morphiiform basal cell carcinoma is a very fast-spreading basal cell. That means it's underneath the skin and it just grows.
It was about September. At that point, they were going to schedule my surgery for April.
Wait a minute.
What? We're
Yes.
talking usually the next week, maybe at the latest.
I know.
You want to treat that as quickly as you can with Mohs surgery. Frederick Mohs developed this for dermatologists, where they actually take a round piece of the tissue, you cut it out right in surgery, then you examine it in a microscope, and then if you see some more cancer left, you go back and take out more, a margin. And then you go back, look at the microscope. And you keep doing this till all the cancer is gone.
I was able to push it into the end of January. I was in there for almost 10 hours.
Yeah.
Between every session that I would go through, I would go out to the car and I would just put the seat down to try to make myself comfortable. He worked in the car all day.
You were seeing this thing getting bigger and bigger
Yeah,
and
I
bigger.
mean, it was bandaged, but the bandage kept getting bigger, right?
And at one
I'm
point,
just-
my lip is just like hanging.
And it was tough, man, I'll tell you.
Oh, yeah.
It was a tough day. You kind of forget how much it affects
I
your
can
loved
see that
ones
right
that
now.
are with you, you know?
So this has been
because-
affecting you, I
Yeah.
can tell.
Yeah.
Yeah. She's my person.
Yeah.
So.
Yeah.
I assume that they set up the reconstruction for the next day.
Yes. This plastic surgeon, it was just out of his wheelhouse. I don't think he was very comfortable tackling my nose to begin with.
You know, these are the kind of things that we love doing, especially as helping someone's life. Your story touches our heart.
Yeah.
So, Shelley, tell us what you would like me to do for you.
You know, I'm a realist in that I know I'm not going to get the perfect nose that I had. A lot of it is the emotional side of it. You know, you have to get up and, you know, look in the mirror every day and you're looking at a different person than what you were used to seeing. So that's hard. And I know that I have a long road ahead of me.
Let's conclude it. Come here a little bit, please. There we go. So that's all inside. So this whole subunit's gone.
Yeah.
Plus the cheek has been advanced a little bit too far inside your nose.
That gives me my Joker smile, which I hate.
All right, let's chat. So there's one solution.
Okay.
That's a forehead flap. We're gonna make an incision up here, lift this up like this, and then move it down into the hole.
Yeah.
The forehead flap is a pedicle flap. The pedicle means it's attached to the blood supply. The blood vessels are right here that feed this part of the skin. We turn it down, we flap it to the nostril. And in Shelley's case, she'll need many stages to make that nostril look somewhat normal. You're gonna have the forehead flap attached, probably for a good 4 to 6 weeks. It's gonna look fat, thick, bulky. You're gonna have no airway at all until we feel that the blood supply that's feeding the end of that flap is good. Then we know, hey, we're set. For the second procedure, then we can sever it. The third surgery, we wanna see if we could defat it, stylize a little bit, make it look better.
Right.
There may be a fourth, there may be a fifth. You be prepared to have a scar on your forehead, like it has to heal from the inside out.
And you can't use any of that skin that's there?
Yeah, because it's already been pulled enough. At the same time, during one of these things, we'll try to revise that scar for you.
Yeah.
You know, the lower aspect of it,
Yeah.
the little dog ear.
Yeah.
There's always a chance that this can fail and it can die. You have a choice here. This is gonna be a long haul and you're not gonna get a perfect result.
Yeah.
You may even say, why the hell did I do this? I should have just left the friggin' thing alone with the prosthesis.
Yeah.
Now, am I scaring you?
Yeah.
Good, because we don't sugarcoat anything.
I know how self-conscious I've been walking around like I am right now. So having to live with a piece of skin, you know, hanging down across your face and attached to your nose, I have to be prepared if it's only gonna get worse before it gets better. You know, I can't imagine living my entire life having to look in the mirror myself with a hole in my face every day. And this is worth the risk to me. And hopefully, this will make me even stronger.
All right, so you want to do this?
Yes, I do.
You're going to have to understand this will look like poo-poo for a while.
I will put on my mascara and my lipstick and I'll rock it.
Good. How do you feel?
I'm excited. You know, just living with the forehead flap for a little bit is the scariest part, I think.
Of course, you know Dr. Frederick.
Yes.
Good to see you. All right, so it's going to look like a big sausage on the left side of your nose.
Like a finger?
Yes. We're bringing the blood supply down. Our goal is to have that blood supply locally from your nose, basically take control.
Yeah.
We're going to have a nice adventure.
Yes, we are.
Today is phase 1 of Shelley's multi-stage journey. I'll begin by harvesting cartilage from her ear while Dr. Frederick raises the septal mucoperichondrial flap to line the interior of the nose. Then I will use the ear cartilage to build the nostril more, and then we'll make an incision on the forehead and rotate the skin down to cover the defect. Lastly, we will close the forehead and stitch the flap into place. All right, Dr. Frederick is going to start with what we call the septal flap. I'll start with the left ear. Suction better.
We've made 2 of our cuts, so you'll be able to use that to close the inside portion of her nose. Right now, we're raising the mucoperichondrial flap.
All right, and I've elevated the skin off the cartilage. Well, that's a huge piece of ear.
Nice job.
Okay, now we're going to kind of make a pocket and put a piece of cartilage in there, which is something that's just going to open up her airway more. Ready for the forehead flap, kids?
Yeah.
Let's do this. When performing your forehead flap, one of the most important things is making sure it's long enough. If you have too much tension because the flap is too short, it can pull up the nostril more. It could actually not heal well. It can scar. It could even hurt the blood supply of the nose. Oh, that's a big one. At least you know we got the vessel in there. This is bleeding. And if the whole forehead flap dies, then we did all this for naught. Our goal is not to have that skin die at all. Let's work on the nose while that top is being closed. So now we're insetting the flap and slowly putting it together. There you go.
I mean, that's pretty damn good. This is gonna look really nice.
All right, thank you guys.
Guys, how are you?
Hello,
Good to see
you guys.
Nice
How
to
are
see
you?
you.
Good.
How do you feel?
To be honest, like looking in the mirror even with this, I almost feel more comfortable with this than staring at a hole in my nose.
Of course, yeah.
Let's take a peek. Okay, I'm gonna just pull this off for a minute. Look at that. Wow. That looks super impressive.
I am very pleased with how the forehead flap turned out. I think they did a great job, you know, kind of just tucking it in along the side of my nose. I've seen some pictures on the internet where they're extremely bulbous and, you know, kind of impair your vision and everything.
So what we'll do around 4 weeks, we'll cut this sausage hanging down from your nose. You know, obviously there's tension here.
Right.
Now, it will drop more once I cut that flap because the flap right now is going, cranking it up.
Yeah.
And then we'll look at the scar and do all these other things.
Wonderful. Well, my granddaughter sent me a little note for you.
Hi, Dr. Nassif. Thank you so much for taking care of Gigi's nose. I love her, and I miss her so much.
Beauty.
Here, do me a favor. Video me for a second.
She would love it.
What's her name?
Diamond.
Diamond.
Ready.
Hi, Diamond. Dr. Nassif here and Dr. Dubrow.
Yeah.
And we took great care of your Gigi, all right? And then when she gets home, you have to be her nurse for a little while.
That's right. She will love that. I'm here with Diamond. She's my nurse. She's taking good care of Gigi.
Everyone, do you remember Gigi had this hole right here?
Yeah.
She had it for a long day, but she couldn't try to fix her nose by herself.
So we got Dr. Nassif, right?
And then Dr. Nassif tried to help her nose, and then it feels better.
Yeah.
So maybe he can come in our dance party and have a lot of fun.
I think he would have a lot of fun. Yeah.
Good morning.
Good morning.
That looks good, except he had a complication here.
Yeah. I've had a little setback with an infection along my hairline. I think I've got it under control now. I had to get some more stitches in there, and I'm back on some antibiotics. At first, when I touched the tip of my nose, I could feel it up.
Yeah.
It was a weird sensation, yeah. But it seems to be kind of settled in.
All right. Bye. We'll see you in there.
Yes.
For Shelley's second surgery, we'll sever the pedicle flap from the forehead, suture up the defect, and excise the excess tissue to give Shelley a better nasal shape. We'll also make an incision along her upper lip and debulk the tissue underneath to make the scar less noticeable. Well, that's me on the camera.
Yeah.
Do I look fat?
No, you look good.
Yes.
Yeah. Can we get table up? The main concern when disconnecting the forehead flap from the nose is the blood supply. You don't want it to die. There is the possibility that it will turn a little purple. That's called venous congestion after surgery. Sometimes we need a leech, sometimes we don't. That should resolve. Try to come close as possible to the dermis. Take a bite right here. Thick scar tissue. So while you close that, I'm gonna make a little incision. Shelley is really unhappy about the scar on her lip. And so my goal is to open up the flap and remove any extra tissue so that it looks more flat and lies normally. I'm just removing a little bit of fat. And then stitch it all back together. She still will have a scar, but God willing, the scar will look a lot less noticeable. All right, so we've done a few things. You've done a great job here at closing this. So we're cutting off more of the pedicle flap. This is way too fat.
Yeah.
So this has to be inset. Take that. All right, so we're closing this flap. We defatted it as much as we could safely. Overall, it's a successful second surgery. I wish we could have debulked and shaped the pedicle of the nostril a little bit more, but it's just not safe because if we overdo it, we can kill it. We'll just keep watching the nose and we might have to perform a third and fourth surgery. Make this look beautiful.
Yeah,
all right, guys.
Beautiful.
Thank you all.
Thank you, doctor.
Thank you, doctor.
Tomorrow morning, I'm heading into my stage 3 surgery with Dr. Nassif. I grew a nose.
Pretty impressive.
Well, the color looks great. I'd have friends. You can see little bite marks.
Oh, you had some leeches?
Don't be afraid. Don't freak out. It's amazing. These little creatures are like little miracle workers. You can see that the scar along my forehead is healing really well. Stage 3, we're going to work on thinning out section of my nose, dropping the nostril down a little bit, and just giving me a little bit more symmetry. I'm just so grateful and can't wait to get this over with and see the final results. Prior to surgery with Dr. Nassif, I felt quite hopeless. In total, I had 4 procedures. One was a forehead flap, detaching the flap. Then there was 2 tweaks to form the nostril.
This is really good. This is gonna look really nice.
Hey guys. When Dr. Nassif offered me the gift of rebuilding my nose, it changed my life.
God, babe, you look incredible.
Thank you. I couldn't have wished for a better birthday gift than this.
With Shelley, there is no way most people would be able to handle what she's been through. She rocked it. Let's party.
Yes. A rare form of skin cancer devastated my face, leaving me with a hole in the side of my nose. I had a prosthetic, but it wasn't very functional. It was like living a real-life horror movie. But now, thanks to Dr. Nassif, I got my nose back. I can get rid of my prosthetic and I can head out the door. I mean, some sunscreen, obviously. My horror movie is over and I'm back to being me.
I think my mom looks absolutely beautiful. I can't believe how amazing Dr. Nassif did.
Happy birthday, Gigi.
Aw, thank you, honey.
Thank you, Dr. Nassif, for having my Gigi. She looks beautiful.
A year ago, I didn't know what the future would hold for me. And here we are today. I mean, it's incredible.
Is it time for a dance party?
Dance party!
There are no words to say how thankful I am and for being given the gift of a nose.
Cause baby, I look good, no matter what they say. I'ma stay the same, yeah, I got the right taste. Baby, I look good.
Hey, how are you? Hey, would you do me a favor? Would you put this in room 5 and I'll be right in to see her?
Absolutely.
Thanks. What's happening?
Hey, buddy. We have a patient. Her name is Jasmine. 1 rhinoplasty. Doesn't like the way her nose looks.
After 1 surgery?
After 1 surgery. So let's take a look at her photos here.
Okay. Oh my gosh.
Number 1, I don't like that scar.
Yeah, why is that scar so bad? Yeah.
2, she's got, which is obstructing the airway, her media crura are sticking out in her airway, looking like little horns.
And a still pretty bulbous tip.
Bulbous tip.
This is not an easy nose to fix.
Right now, I have a nose that's bulbous, uneven, with an ugly scar, and nostrils that are collapsed that are starting to affect my breathing. A couple strangers told me that I needed a nose job after I had gotten a nose job. Yeah. And someone told me if I went to jail, I could shank someone with my nose. Awesome.
So how was your work orientation for the new job?
It was good, but they took my ID picture on the first day.
I know where it's going, yeah. And?
It looks so bad. The lighting wasn't good, and it was like straight on.
So because of your nose?
Yeah, it just didn't look good. My parents are immigrants from Iraq. Because my parents are Middle Eastern, I was blessed with just a stereotypical Middle Eastern nose, which I kind of resented growing up, even though I love my culture. My nose and the bump just didn't match the rest of my features. So in 2020, when I was 17, my mom took me to the surgeon to fix my nose. Surgery got rid of the bump from my side profile, but it left me with a bunch of new problems. I started to notice the cartilage that was poking out from my nose. There was a prominent scar.
When you edit your picture and photos, do you use an app or?
Yeah, like the tip, I try to like make it a little bit smaller, or like the scar that was left from the last surgery, I try to get rid of that.
Yes.
Being raised in a society where social media dictates pretty much everyone's perception of you, unfortunately. It's just kind of a huge part of not necessarily just my life, but just the college experience in general now. I don't want to have to go through all these milestones where, you know, people are going to take a lot of pictures and look at my wedding photos and be like, ugh. I don't want to have to deal with that for the next, who knows, 60 years of my life.
Hello.
Hello.
How are you guys?
Morning.
Morning. Terry Dubrow.
Hania.
Hania.
Yes. Jasmine.
Jasmine, pleasure to meet you.
Nice to meet you. Oh, you're tall.
I am tall, yes. Hania, nice to meet you.
Hania.
Hello, sahlan.
What does that mean?
Like
Hello,
what?
how are you?
Welcome.
Welcome. Yeah. Hello. Hello, welcome.
Yeah, he knows a few Arabic words.
I do.
see?
Yalla.
Oh,
Yalla
okay.
habibi.
Yalla
So it's-
habibi,
Yalla
that's
habibi.
good. Yeah, but he also says-
Hakruti. What's hakruti?
Akruti? Is that Lebanese?
Oh, is that dirty?
It means bastard.
Oh, no,
Okay, but you've been calling me this whole time? Yeah. This whole time I thought it was like sweetheart.
Did you really think
did.
that I'd
I
call
thought
you a
Kruti.
loving term like that?
Yes. Yalla kruti?
Yeah.
That means hurry up,
you
asshole?
No, bastard.
Hurry up, bastard.
Yalla akruti. Yalla akruti.
What's that dessert? Baklava?
Baklava.
No, we say batlewa.
Baklawa. Baklawa in Lebanese. Baklawa in Iraqi.
Do you make it?
Yes.
Is she a good cook?
Yeah, she is.
The filled dough and
Really?
pistachios
Everything.
and walnuts.
Where were you born?
In Texas, yeah.
Actually, I wish my son Gavin would meet her. He wants a nice Middle Eastern girl.
I'm a traditional woman.
You're pretty tall, though.
I'm 5'9".
You're a few
How
inches
tall's
taller
Gavin?
than you. He's 5'7".
What are the chances, in reality, that you would actually marry a guy who's shorter than you?
I don't know, honestly.
Are you taller than your wife?
She's 5'5".
And you're what, 5'3"?
Like on a good day.
Oh, a good day. All righty, there we go.
My ideal guy. Tall. Maybe dark hair, but as long as he's nice, he loves his mom, he has good morals, then, you know, I might be sold.
So you're 19.
Yes.
You had your nose done when you were about 17?
Yes, sir.
Give us a little background of your nose.
I had a deviated septum, which I was excited about because I was like, let's go, I get a nose job. So we went in for the breathing, but I was like, maybe we can also.
You know, while you're there, that phase.
Yeah.
So that doctor
Killed
you
two
went to for the breathing
Yes.
did the cosmetic part
Yes.
too.
Yes. I definitely had a bump on the side.
Okay, so that's a typical Middle
Yes.
Eastern.
Yeah, she has
Yes.
my husband now.
Okay. I had the Middle Eastern nose with the hump, and I got mine done so I can completely relate to Jasmine. And so what happened?
Whenever we took the cast off, we noticed that there was a prominent scar, and my tip was really high up. So, I mean, it's still high, but we just continued to just hope that eventually it would fall a little bit more.
Yeah.
Yes. On occasion, I think that people think that
That's a booger, yeah.
And that's why I
Little
told her
bumps.
before, because I'm her mom, I love her, but I told her your nose is like flying, and when I look at you, I
Really?
just look at your nostril and the meat right here is like,
And the meat.
The meat.
meat.
Oh. So that's what
But that's
bothers
the
you
truth.
too, Mom?
yes.
What happened to your breathing?
now whenever I take a full deep breath through my nose, my left nostril kind of collapses. But the tip ultimately is just the biggest concern in all that
The whole
it
thing is
encompasses.
the tip.
Yeah.
Like if you look from this side, it is more pointy and like triangular.
Yeah.
And then from this side, it's a little bit more round. So ideally, it's just symmetric on both sides.
I like what you just said.
Symmetric. I knew you were going to
Yeah.
So, I almost brought it up, but I say symmetrical.
And I say symmetric.
He says symmetric.
This is a big issue between the two of us. Symmetric is the right way to say it.
Okay.
So we're just smarter than you. Hello, hello.
Hello.
Ahlan.
Ahlan wa sahlan. So do you speak fluent Arabic? Or
No, I only speak a few words.
He barely speaks English. You kidding me?
Oh, God, here it goes.
Here we start again.
They laughed.
Thank you, my friend. Breathe in for a minute. Okay. Boy, he really claps. Yeah, that's some cartilage. I think, yeah, it's a little piece of cartilage. Okay, I'm gonna look inside, okay?
Okay.
Here, Terry?
Yeah.
Feel how narrow that is when you go in, you feel that bone right there.
Yeah.
So there's a few different things, okay. All right, so what's going on here, you're narrow.
Okay.
So we have to add cartilage called spreader grafts. So now with me adding these little support grafts, we're gonna take the tip and tighten it.
Okay.
Make it smaller.
And how about that scar? And
Well,
drip-
the scar, so let me tell you the bad thing. I have to lengthen the nose. The skin is gonna be stretching more.
Yeah.
Okay.
that means there'll be more tension on that scar.
Okay.
So I would expect the scar to not be any better.
Okay.
Matter of fact, when I lengthen someone's nose, many times the scars even break open, you know, and becomes not a nice looking scar. But one thing I do know for sure, which I want to tackle, is those things, those wings inside you.
Yes.
So do you want to do this?
Yes.
For me, what I love about the plan, for not only you, but for him, is that if he fixes that, then you will be more open to dating the very, very short guy,
So all of this is just so I can date his son.
basically.
Okay, awesome.
You can make fun of me as much as you want, as long as the desserts and maybe some tabbouleh.
Just
you know, a
prepare
little
kitchen
pataya.
for me, ingredient, and it will be there.
All right, pleasure.
Thank you.
Thanks for coming out.
Great pleasure
Thank you
meeting
so
you.
much.
Thank
You as
you.
well.
Great pleasure. Thank you.
Hi, good morning. Good morning. I'm checking in for surgery with Dr. Nassif. My name is Jasmine. My last time touching this nose. I won't miss it. I won't miss it.
Hit them with the backbeat. Feel it. Feel it.
Oh! Oh, God, that's cold. All right, let's do it. Jasmine's got a very bulbous tip. However, if you just make the center part of her tip smaller, the sides are gonna collapse in more. So we have to do something where we can make the tip smaller in the center, but then on the sides, open it. That's always the trick. For Jasmine's surgery today, I'll begin by opening her nose while Dr. Ping harvests rib. Next, we will assess how to remove the protruding cartilage and debulk her tip. We will then add spreader grafts to open her airway, straighten her nose, and lower her nostrils. Finally, we will insert infratip grafts and inject finely diced cartilage to push out the sides and make her tip more symmetric. I'm starting now.
Okay.
No, that looks like scar on her tip. I mean, this is just like a mess.
We've opened up the nose. There's scar tissue absolutely everywhere. That scar tissue is contributing to the fullness of the nose. So we're gonna have to continue to work through it and see what we find. Oh, that's a stitch. There's a permanent, ugly-looking stitch in there. Wow. It's rare that I find permanent stitches inside the nose. There's more stitches. Back in the old days, many doctors were using permanent stitches. Now we use sutures that will dissolve in about 3 months.
Alrighty, our ribby's coming out. Hello.
Oh, hello. No, all right, so we're gonna have to amputate. Columella and medial cura overlapped, causing a lot of fullness on the tip. That's something that I've rarely seen. What's making Jasmine's columella and tip wide is some of the cartilage is intertwined upon itself like the medial cura, which is the cartilage right here. So our goal would be to remove cartilage, fixate it together, add some grafts to get it nice and strong, and actually make the columella less wide and give her a better looking tip. So make sure on those spreader grafts, they're extending a little bit beyond the length of the septum. That will help lower the nostril a little bit. Section. We have to see what the projection is now. All right, so the profile looks a hell of a lot better.
So much better.
I'm very pleased with everything. And initially I thought that I would not be able to make the scar any better. However, the final step is some great suturing techniques. Then when it heals, it should heal straight like this, not like that, creating a wide scar. All right, beautiful job.
My future seems a lot more exciting to me now that I know that my nose isn't something that I have to hyperfixate on all the time. In events such as my graduation, my wedding, when I have kids, I don't have to be thinking about my nose, but can actually be enjoying the moment to the fullest.
Hello! Oh my God, look at you. How are you?
After my first nose job went terribly wrong, I would have never thought that I would have been able to fix it. Now, thanks to Dr. Nassif, my tip's proportional to my face. I feel really cute. side profile. You can no longer see up my nose. My scar is almost gone. I don't have pieces of cartilage sticking out. And now I'm super excited for all the pictures that I'm gonna take. I would say that my nose is now symmetric, not symmetrical. I look cute.
Wait, did you bring me my batlawa?
Yes, batlawa. I made you homemade batlawa.
Oh my God.
It's homemade from scratch. It's pistachio.
Oh my God.
It's just a simple thing
Yo.
to say thank you.
Come here, Habibi.
Hello, Doc.
Come here.
Hey.
How are you?
Habibi.
Good to see you.
Thank you.
Oh,
Good to see you. Hello.
Look at you. You look great.
Hey, I made him some baklava. I don't know if he's gonna share with you.
Shukran, Habibi.
You're welcome. عفواً.
That was so good.
Oh,
it was so good. Oh my gosh. So good.
So let me see you now. How you doing?
I'm great.
You're
Awesome.
about 4.5, 5 months?
5.
Still a little swollen.
Yeah, you're still swollen. Remember, it's a process.
Yes.
Head back.
I love it. Look
Okay,
at the
so that's
scar.
better.
I don't miss the meaty pieces from the cartilage that are coming down from Jasmine nose. I love it right now, and the scar is like gone. How about we take a selfie with you guys?
Oh, yeah? You want to take a selfie?
Yeah.
Oh, you have them? Yeah, let's do it.
Phone.
Let's do it.
Stand up. Stand up.
You-
Stand up
do
tall.
you need to- do you need me to-
There you go. Okay, that's perfect. Steve.
Here we go. How's this?
I'm gonna do my thing.
So nailed that.
Killed it.
All right,
Hug.
bye. Let's hear it, Laura.
We have to do 3 times.
Oh.
That's Arab way.
Yalla.
I feel like my nose looks like a caricature. Like it looks like someone drew it on wrong. My nose looks like a ski slope. I have a very low bridge. It almost looks like a little ball on the end of my nose. You can really see inside my nostrils, and this middle part is hanging down a lot lower than it ever was. From the age of about 8 years old, I always felt my nose was bigger than a lot of the other kids. They would come up to me and say, "Oh, you have a big nose." I used to keep, a little diary, and I would constantly write in it about how I hate my nose. It's so big. So I begged and begged and begged my mom to get a nose job. And at the age of 19, she finally agreed. I thought my prayers were answered. When I was younger, I literally thought I could have your nose on my face. I didn't, I have a big nose.
I want to say your nose is big. I think what really is your problem is the tip.
I got out of surgery. Things weren't quite right. I did notice a big reduction in this area, but I noticed that my tip and my nostrils seemed like he didn't even really touch them. And as time went on, each year, I feel like the cartilage, the skin, everything just kept shifting and moving.
Over the years that I've known you, your nose changed a lot.
It changed a lot. A lot. So when I'm at work and I'm cutting a client's hair, I will actually glance in the mirror and look at my nose. I will look at the mirror behind me because I'm able to see a side profile. I've even gone as far as taking selfies in the back just to see what it looks like in different lighting. I think about this on a daily basis. I know Dr. Nassif, this is what he does. Difficult cases like mine, even worse. And I literally feel like he might be the guy who'd be able to get it right.
Yeah.
And that's why I've
this
waited
is your face,
20
right?
years.
Yeah.
Because I'm like, you know what? It's scary. This is my face.
Okay.
What do you got?
I'm just going to show you. This says it all. This is Kristin.
Oh, no way. That's not real.
Look at those nostrils.
That looks like one of those distortion filters. You got to bring her in and fix this. Like this is an emergency.
Kristin.
Would you please ask Kristin to come in?
Hi.
Kristin, hi.
Hi, nice to meet you, Doctor.
Dr. Nassif, how are you?
Terry Dubrow. Okay, nice to meet you.
Pleasure to meet you.
Karen?
Dr. Dubrow.
Hi, Karen.
Nice to meet you.
Nice to meet you.
Well, now, what's the relationship?
We're just good friends.
Good friends. Well, come on in, have a seat.
Thank you so much.
Obviously, we've seen your nose.
Yes.
It's a spectacular nose. Tell us about the history with the nose.
So growing up, I always just thought it was big. In high school, I guess I was kind of obsessed with it, just always looking at it. I would look at pictures. So my mom decided that she would help me to get my nose done. But we
Good.
started researching for well over a year. Like, I have lists and lists of names of every plastic surgeon in northern New Jersey, New York.
So you did your research.
Oh, we did our research. We would go on these consultations asking them their ideas of imaging, and we brought pictures showing them what we wanted. Then finally, I chose. I told him, you know, I want a lot taken out, I want it reduced.
And what did the doctor say? Sure?
He kind of disagreed at first, kind of trying to tell me, I guess, not to take out so much, but I kept insisting that I wanted it, you know, smaller and have it turn up. And I think eventually then he kind of was like, okay, I think I can get you where you want to be.
You negotiated your plastic surgery.
Yeah, that's kind of a little bit unusual and different. You do have to listen to the patient. However, if it's something that you know is either dangerous or it's not gonna cosmetically look pleasing, then you don't do it.
Were you ever happy with it at first?
I was happy with it because I felt like it
Smaller.
was better, it was smaller, but after that it just kept getting worse and worse.
And I've known Kristin for 10 years now.
Yeah.
Her nose wasn't like that. Like when I first met her, it looks like she's got like almost like a wart on the end of her nose.
The skin's
She
thinning
never
out.
had that over the years. It's gotten worse.
Looks like it almost wants to come through.
So why did you wait till now?
I'm really scared.
Yeah.
You know, I have really thin skin.
If one can do that,
Right.
what could
You
a
know,
revision of this do?
Exactly.
So knowing you are the research queen, what do you want?
I want this to be a nice, refined version of what I have.
Okay, so let me just stop you. You just used the word refined. That's not happening with you, refined.
Okay.
The only word I want to hear from you is reconstruction.
Okay.
Don't go in the same route that you did with that original doctor telling him what to do, if you don't mind.
Yeah, absolutely. So
Does she have a choice?
I'm because
Is it me or is he really mean?
I'm being tough for a reason right now. When I hear the word refined, that means we're taking a nose that's already been destroyed and the skin's tight around it and even making it more destroyed. Kristin is doing the same thing to me that she did the other doctor, but here, since this is a revision, she's being unrealistic.
I want to see this part straighter instead of having that S-curve.
Okay.
I want the tip not lumpy. I want that smooth.
Okay.
And the nostrils where it's not like one is way bigger than the other one.
More natural too.
Oh, yes.
fits your face.
Yes.
Okay, well that's kind of what I've been waiting to hear.
Yes, yes.
You want to have more of a natural, functional nose.
Yes.
That's cosmetically pleasing to your face.
Absolutely.
Right?
I like to control things a lot and usually be in charge. So I'm nervous as to what they think needs to be done with my nose and how complicated they think it's really going to be.
Okay.
Look at that bassa.
Yeah. Yeah. Prominent.
Bassa's that piece of cartilage.
Yes.
I'm just going to feel. Can you come closer to me? I'm feeling your bones first. Feel that right there.
Yeah.
Breathe. You like that?
Mm-hmm.
So that's from the middle vault of the nose being narrow.
Thin skin.
Yeah. This is like wafer thin.
Yeah.
That cartilage is gonna pop right through.
Yeah.
And this is all tip cartilage. So what I just did to make you breathe better is I went like this.
Mm-hmm.
See that?
Yep. There's nothing there. There's like
But
nothing.
you see that it was wide?
Yeah. Yeah.
And?
I mean, I know that's what it needs. That's what it needs in there in order to make me breathe.
So you're okay with that?
Yes. Yes.
Okay. So let's talk about the overall nose itself. So most likely what I'm gonna do is take this whole piece here, I'm gonna throw it away and reconstruct all this to bring it back and make it look rounder.
Right,
Okay.
right.
Now I'm gonna add a piece of tissue called perichondrium, the layer on top of the rib.
Yes.
Then I might even inject that perichondrium and inject your skin, because your skin is so thin, with something called nanofat, multipotent stromal cells from your belly. Those are the best, richest cells, and it actually will help grow a little bit of thickness in your skin, maybe over a year.
Yeah.
So I want a blanket over your nose.
Okay.
But there's one thing we didn't address. Your nostrils.
Right.
So for me to pull that nostril down, I have to add skin and stability, cartilage.
Mm-hmm.
And I get that from inside the ear You'll have an incision inside both ears. So we need to add those to lower your nostrils. It's really important for the doctor, just like I did, to give a full breakdown of the risks of each procedure. You never want to leave anything out. You want to do as much of a pre-op. We're talking about the expectations and risks as much as possible with every patient.
Yeah.
This is a big, major reconstruction. Your nose is going to be swollen, like a sausage, especially your tip. Especially if we use these big composite grafts, your nostrils are going to go, they're going to be big. You're going to have a kind of a fat nose for a while. So what do you say? What are your thoughts about everything you heard?
I'm overwhelmed, I guess, at this point.
Yeah.
It's a lot of
nervous,
information.
overwhelmed, and you
Like,
just...
I know there's a lot going on in there, but it's a lot. It's scary. Yeah. So I'm just overwhelmed. I know there's a lot going on in there, but it's a lot. Yeah. So I'm just overwhelmed.
He's done noses like this, not hundreds of times, literally thousands of times, and it's going to be exponentially better, whatever that really means. Ask as many questions as you want, but just release yourself to his process, or maybe not do it.
So this is something where, you know, what we call the risks versus the benefits.
Right.
If we decide to do this, it's not a guarantee.
Right.
So what do you think you want to do?
I don't think so.
Okay.
I'm not ready to move forward with surgery.
All right.
This surgery is a lot more extensive than I thought, and I'm very unsure of how my body is going to respond to that as far as healing, and that really scares me.
I mean, this is traumatic for her.
Yeah.
She doesn't have confidence in herself, is what she's saying.
That's
you know,
my...
When it comes to buyer's remorse, I'm going to use that term.
Right.
If you are not sure, this would be like the last thing you want to do.
Okay.
Kristin's feelings are 100% normal. I applaud her for making that decision to not do surgery this time, and that was the right move for her. It was a pleasure meeting both of you.
Yes, you too, Dr. Nassif.
So nice to meet you. Thank you. Great pleasure meeting you.
Thank you very much. Thank you. This was something that I looked forward to. Sorry. Is it okay that I'm crying? And I was very excited about.
There's no guarantee for anything.
Right.
But unfortunately, you're going to choose to not do it.
It's not his skill that I'm worried about. It's me and the extent of the surgery and my own body.
You know, you'll move on from there, and, you know, you'll be happy, hopefully.
Yeah.
So I have a patient, she had multiple surgeries, cleft, palate, lip, and then you had the cleft rhino.
Okay. Ooh, what the hell happened to that? By the way, great cleft lip repair.
I know.
That's really
beautiful, huh?
good.
Yeah, so something happened to destroy the soft tissue of her nose.
I was born with a cleft lip and palate, and I have had more surgeries than I could ever remember. Growing up, it just wasn't easy for me at all. I remember getting my palate worked on when I was a little kid, and then they had to break the jaw and kind of move it back a little bit. Then they did the cheeks of my face. They put metal in there because I had a flat face. When I went back to school after having a surgery, I was bullied a lot. They would be afraid to come play with me. What happened to her? You know, she looks different, she looks scary. It made me a very shy kid. So at the age of 17, I was ready for my final surgery. After surgery, it was a disaster. It looks like somebody took a knife to my nose. So the teething did get worse, and that kind of scarred me for the rest of my life. The biggest thing right now is the crease in my nose. Having people like staring at me directly in my face, it's just a training. And it makes me not want to go anywhere. It just makes me want to stay in my own little bubble.
Well, welcome.
Thank you.
Where do you guys live?
Yes.
Atlanta.
Atlanta.
Nice.
But I'm from Massachusetts.
Where?
Brockton.
I know Brockton.
What were you doing there?
So, because my whole mom's side of the family, I was there every summer. We used to go to dig for clams. You take a big rock and you throw it. All these clams will pee. So we know that's where the clams are.
Are we believing that?
Very
I don't know if it's pee.
Are you believing that?
We need to look into it.
A clam pees when you throw rocks.
What do you say? Do clams pee?
Do clams pee? Clams pee?
It's a lot. It goes.
You know what they're called? A piss clam. Wow. Things you never really wanted to know.
Yeah. So you had some great work.
Cleft palate and cleft lip? Wow.
Correct.
Really, really perfectly executed.
Lip was open with right here called the maxilla and the teeth. It was all the way open.
Right.
What about the palate?
It was open as well.
A big opening and bone too?
Mm-hmm.
A cleft lip is basically a genetic deformity. I have many patients that have already had cleft lip repairs, but sometimes what I'll do is revise the cleft lip or make the scar look a little bit more even. And then of course I'll do the noses.
I was in high school. I was about 17. They decided to do the nose.
In high schools, usually when cleft lip nasal patients have what's called the formal rhinoplasty, the big one.
Mm-hmm.
So here you are. You must have been really excited about that in high school.
It was gonna give me the look to be, on the normal side. It just went the wrong way.
But wait a second, you didn't go in with a crease, right?
No.
How long after surgery did you develop a crease like that?
It was like 2 months.
2 months.
And what did the doctors say? Did the doctor look at that and talk to you about it or what?
He didn't really explain what happened. He kind of said he didn't know either.
You were healing, all of a sudden you get this crease.
Mm-hmm.
And it doesn't go all the way through, does it?
No.
After all these years of doing 25, 30,000, 40,000 rhinoplasties, I don't understand that completely. I don't think the cleft lip nasal deformity caused that crease, even though that will cause some irregularities of the cartilage. I think it's from previous aggressive rhinoplasty surgery. Can we fix it? That's gonna be the $1 million question.
Sorry to say this is unbelievably fascinating and terrible for you, and we're sorry it happened.
Thank you.
But if anyone can fix this, let me know. No, I'm kidding.
I wasn't expecting that.
If there's anyone on the planet that could fix this, you are looking at them. Hey guys.
Hi.
Jalissa. I like that name.
It's pronounced Jalissa.
Oh, Jalissa.
Yeah.
What's your middle name?
Like Mellissa.
Darlin.
Jalissa Darlin. That's pretty.
D-A-R-L-I-N.
Yep.
No G.
No G.
Okay. Guess what my real name is?
It's not Paul?
No.
You're kidding me.
That's my baptismal name.
Oh my gosh.
Sabin, my father's name.
Rather than contribute to the paying the
Seven.
bill, you be saving all your money.
Oh, God. All right, so let's take a peek. I'm gonna touch inside your nose. Okay, your septum is intact. So, yeah, they did the advancement of the nostril, and that might have been done when you were really, really young. And they did all that work like they're supposed to. Here, they did even a nice job on the right nostril. There's a piece of ear cartilage, I think, there. All right, let's talk about the overall nose itself. We need to do numerous things to it. One, build up here to bring the nose out. I have to add projection here, add projection here. Number two, the goal would be to pull down the left nostril. We can try.
Okay.
Now it comes to the crease. That's gonna be the challenge.
The crease is a missing tissue case. And if he could find some way to bridge that gap, that would be ideal.
The limiting step for us is gonna be a really thick skin. So you're not gonna be able to see the outline maybe of, the cartilage or like a sharp nose. The goal would be an improvement to get a better looking nose. When you are operating on the nose with thick skin, the negative thing about that is swelling. This will take about a good 3 years to heal, and hopefully we'll be able to get some definition. Will you be happy with this small improvement?
Oh, yeah.
Let's try to change your life for the better.
Excited.
Thank you.
So nice to meet you, Candace.
Nice to
Pleasure.
meet you.
Thank you. Bye.
You got this.
I have faith. I have faith he'll do it.
Wait a minute.
Mom.
Oh! What's your name?
Alethea.
Oh, Jalissa and Alethea. Dr. Frederick.
Hi.
Hi,
Nice to
how
meet
are
you.
you?
Good.
Nice
All
to
right,
meet you.
well, welcome.
Thank you.
How are you?
I'm good. I'm a little nervous.
So there's been some issues. So this is a big change that came to me during the weekend. There's something called the body, mass index, BMI. BMI is over 50, we don't do general anesthesia. Your BMI was over 50. The last thing we want to do is put you in any danger. So luckily, the great news about doing under local, it's a lot safer. We're going to numb you up. Do you have any questions?
No.
Mom, pleasure meeting you.
You too.
All right, I'll let you sit here and hold her hands while she gets an IV.
Okay.
All right, I'll see you later on. Okay. I can't believe how calm Jalissa is. Matter of fact, I'm more nervous than she is. And to top it off, this is going to be the first time I performed a complex rhinoplasty under local. All right, bye.
Bye. Bye.
So with Jalissa's surgery, the biggest pivot we're doing today, it's under local anesthesia, complete local with just maybe a little bit of Versed, which is like some IV Valium. Today for Jalissa's surgery, we'll start by opening her nose and inserting a double-layer diced cartilage glue graft to give her projection in the middle vault. Next, we'll insert a large columella strut to give her tip support, and then remove skin from below her left nostril and pull it down so both sides are symmetric. Finally, we will attempt to excise the crease and stitch the surrounding tissue together before potentially placing cartilage from either the cadaver rib or her ear to fill in the crevice. You can't feel anything, right?
Well, I'll make pressure.
Yeah, if you start feeling anything weird, you let us know. It's Dr. Frederick's fault if you do.
Good.
One of the challenges about doing a rhinoplasty under local is if there's a problem or a complication or something I need to discuss with the other doctor, or I want to cuss because something's hard. I can't do that. She's awake. So I want something long for the middle. And I kind of want to go all the way back here. So could I use one of these?
Yeah, use this one.
That gives us some more volume. I have one of my nose revisions under local. I got so nervous while I was on the table, I had to go pee. So they had to bring me one of those little things I can pee into. And yes, I was a baby. We're working on everything in your nose. We just put something to help build up the profile. And it's going beautiful. You have the glue? I don't know how this is gonna work. Let's have it pull down. I want to perform a left alar advancement flap. Basically, remove a piece of skin below the left nostril to make things even. And then try to pull that left nostril down and fill in that gap.
Do you have a toothpick up, please?
I have to say, this is a new procedure. It's rare for me. I did it once before, and that was about 3 weeks prior. Can you feel this here? Sharp?
Yeah.
Give me a little local.
We're really close to being done.
Yeah.
So, you know that little cleft that you had? So we tried to just cut it out and stitch it back together. But I'll be honest with you, I'm not happy with it. You want to make it better yet? Guess what?
Composite? Yeah.
Take a small composite. Just cutting out that crease. There was still an indent. So what I want to do is try to think out of the box and do something I've never done before. So it's almost like taking a pie wedge of skin and cartilage from the ear, inserting it into the crease defect, and hopefully surrounding tissue will somehow gently just feed it until it actually establishes its own blood supply. I know I added one more thing by doing this to you, but you're gonna get a better result. Go ahead, this section first right now.
That's what I want.
Yeah, we're not here to go half-ass. So Emma, how was this?
It was amazing.
You think this, you said, was better than being
Oh yeah, it's better
asleep?
than being asleep.
Why?
I felt way more comfortable.
Really?
Oh yeah.
Well, yeah, but you're not gonna know if you feel comfortable when you're sleeping. You're sleeping. How does the size of the nostrils look compared right to the left?
Now
They
it
look
looks much better
fantastic.
than it was pre-op.
It looks fantastic.
Let me look. Right now, I gotta tell you, I'm very happy with the way things are turning out. Thank you, guys.
So, how are you feeling?
I feel good. I think I have really high pain tolerance. I don't know if that's normal.
Well, you've been through a lot.
Hey. Oh, you bought my good friend, Alicia. And actually, I met Alicia on surgery day.
Yes.
Okay.
We had to make a big pivot.
Why?
The BMI calculation was a little off.
Okay.
So they wanted to cancel. They said, we can't do it. I said, what about local?
With sedation, I assume.
No, she had 1.5 milligrams.
Whoa, so you were awake
So
for
we
the whole
injected
thing.
her.
Yeah, it was good.
And actually, it was not a short procedure.
How long was it?
3.5 hours.
Oh my gosh.
Now, let me take a quick peek at you.
Can you give me a 4x4?
Whoa.
Can I have a Q-tip, brother? Yeah. So that's looking pretty damn good. That's a composite graft.
That's ear skin? I can't believe that. Are you a little shocked?
I am. Even my family was shocked. They were like, you look different already. He did a great job.
Dude, I'm really rubbing off on you.
Yeah, you are.
I finally got the surgery I've been asking for, that I've been waiting for all these years. I even got more than what I wanted, to be honest.
I've never been able to pull a nostril down that much.
I think it's wonderful. I want to kiss the tip of it.
Go ahead. There you go. All right, we have to see how you heal to make sure this lives.
Thank you so much.
Lisa, pleasure meeting you.
You too.
Bye, Mama.
Thank you.
Bye.
Bye. I'll see you guys
Bye.
later.
Bye.
Thank you.
Bye.
This is a journey I thought would never be over. With everything I went through in the past 30 years, having more surgeries than I can remember, fixing my cleft lip and palate to finally be done, especially with the nose surgery, it feels so amazing. I can't even explain how it feels. It feels so good to be out.
Beautiful day. This is what I wanted for you too, to be able to hang out and just worry-free.
Oh yeah, I feel amazing.
I feel complete that you feel complete. Dr. Nassif exceeded our family's expectations. Jalissa has my mother's nose now, I can see that.
It was definitely worth the wait. Dr. Nassif helped me be me again and make me feel like I'm part of the world, you know, and not feel like an outcast like I have been. He's able to pull this side down. He's able to give me more like a bridge, you know? I looks good. He helped me with the really deep crease that I had. It's like barely even noticeable anymore. Everybody says I look great, so I know I do. This side is actually my favorite side now, so I don't know which one to pick.
That's good.
Dr. Nassif wasn't able just to fix my nose. He also helped me heal from bad experiences. I don't have to worry about people thinking negative about me because I don't even think negative about me anymore. Pinky promise I won't say no, that I'll be down for anything and everything.
Okay.
As long as we're not jumping out of a plane, I'm there. I'm all in. I am all in.
Okay, I'm gonna hold you to that.
Got some photos for you.
All right.
This is Robert. From what I know, Robert had 4 surgeries. And then, boom.
Tip necrosis.
So necrosed.
Could you imagine the effect this has had on his life?
That's what we need to find out.
My nose is fucked up. Looks like some boxer hit me. Looks very horrible. Maybe we should just cut it everything here and then put it just new nose here.
So difficult to find good makeup stylist.
If I can make you happy, then I'm happy. It was always my dream to be a makeup artist. I went to makeup school in Germany. My first experience with celebrities was Claudia Schiffer. Also the Pussycat Dolls in Germany and Sharon Stone. I love her. Everything is perfect on this woman, you know? And I dreamed always to have such a nose type like Sharon Stone. It was not ugly, my nose. It was really cute, normal. But as a makeup artist, you have other vision in your mind. And I wanted to do my nose job always. Elevated, narrow. Okay, my sexy doll. I had 4 surgeries, but the last plastic surgeon made it a lot worse. I wish I would never let him touch my nose. It took part of my life, 2 years of my life, because of surgery, recovering, depression. I hate my face right now. People say, how can you be a good makeup artist with such a nose? And that's make me really crazy.
Hello.
Hi.
Dr. Dubrow and I were looking at your photos. So why don't you take us through your journey about where this started and what happened?
I wanted always to have the really pretty nose with shape and something like that, yeah. So the first surgery is rhinoplasty. I did it in Armenia 7 years ago. But the issue was after 2 years, I went to the US, the nose tip went a bit down.
Down.
Not a bit, a lot. Yeah, a lot, yes. And I found some doctor, I went to him. So he promised me to fix it. After he did, it was a bit damaged.
Was there a scab at all there? Or?
Yeah, there was here.
Yeah. All right. How does that happen? It could be the dissection is too thin, too close to the skin, and everything dies. It could be that tissue is not great blood supply. Necrosis can happen and sometimes does.
After 1 year, he said, okay, we can try another surgery. He did the third surgery. And after 1 week, I came to him, he said, oh my God, okay, this is not exactly this nose what you wanted.
Why did he say that? Was this thing here?
This thing was here a little bit, and he said, I have to fix it.
This is now number 4?
Number 4 surgery. He said, I have to take your cartilages from both sides.
Both sides?
So from here, he took some bone, I don't know.
You did a graft from your jawbone?
Yes.
No plastic surgeon would do that.
It's not a thing. What kind of doctor is this doctor?
So I figure out he's not a plastic surgeon, he's a dentist.
Your dentist did your nose job revisions?
Yeah.
Was there any indication that this plastic surgeon was actually a dentist?
The little goodie bag with toothbrush and the little toothpaste that I love getting.
Yeah. No?
No.
A dentist doing plastic surgery is no better than a plastic surgeon doing dentistry.
I think I let you clean my teeth.
Yeah.
You can polish my canines.
Oh, God. Okay, so you thought you'd let him do a revision, but once he lost skin on the tip and it dented in, weren't you?
Maybe I should, but
He wanted to give him a chance because he truly trusted him. Yeah, so.
Very, very trusting man.
Wow, you're a nice guy.
So, Robert, what would you want to have done to your nose?
To do our best just to have a nice nose. My nose looks like here, eagle. It's really similar.
Obviously, you have a significant problem. So what we need to do is see what's going on, and then at that point, let's have a conversation of where this can take us to. Alrighty, sit up for me, and we want to examine your nose, okay? Okay, so bone, and then nothing. The whole cartilage, the whole lower half of the nose is gone. That's good, okay. So he also has columellar necrosis.
Oh, wow.
You're a smoker. I can smell it out of your lungs.
Smoker, yeah.
When was the last time you had a cigarette?
2 days ago.
Were you smoking when he was doing these surgeries on you?
He said you can smoke. If you want, you can smoke.
This guy needs to lose his friggin' license. What happens when you smoke, the nicotine, it constricts the blood vessels. That decreases the blood flow. Decreased blood flow means decreased oxygen also. And when you have that happen, you get dead skin, dead tissue. Most likely that is the cause of the skin death. So that's a bad thing right there. So we got a bunch of problems going on. I'm trying to think out of the box here, and I don't know, I think it should work. But we take the rib, we take the tissue on top of the rib, it's called perichondrium. It's really full of blood supply. And I build your nose, and then cut this circle out. I remove it, and then take some tissue from here and put it where that hole is. However, you need to stop smoking. Minimum of 6 to 7 weeks before any surgeries. And then after months. If you even take one hit of a cigarette, you'll kill everything.
Yeah, I know.
And then I won't touch you again. It'll be your fault, and I'll say goodbye. Can you really stop smoking?
Yeah.
And I don't want you just to say, yeah, just to blow smoke up my butt. I want you really to think about this.
I have to do it.
Okay.
I have another choice.
I'm willing to take a chance and operate on Robert. But the way I'm gonna do this is take some blood samples from him weekly for a full 6 weeks before surgery and make sure he is nicotine-free. So now, God willing, the next time I'll see you will be at the bedside going into surgery. Because you've succeeded in the cessation of nicotine. Pleasure, thank you.
Pleasure to meet you.
Hi, good morning. I'm Robert. I'm taking for my surgery today.
Great. If you want to just grab a seat, I will let them know you're here.
All right, thank you. It was really hard to quit the cigarettes to nicotine because I smoked over 30 years. But I promised and I did it for my surgery, for my nose, for everything.
Hey, brother.
Hi.
How are you?
Good, how are you?
First of all, I'm glad that you stopped smoking.
Yeah.
That's so important. I'm proud of Robert. He's been coming into my office every week for a full 6 weeks, and he's been nicotine-free. This just shows you how bad Robert wants his nose fixed. Now, our next step is to see what we can do with this crevice. And the hard part is going to be opening up your skin and seeing what that looks like. This is going to be a little bit of a challenge. Actually, a big challenge. Today for Robert's surgery, I will take skin and cartilage from the ear to make composite grafts, while Dr. Frederick harvests rib. I will then open the nose and use a columella strut graft to add projection and open the airway. I will use rib perichondrium with fibrin glue and a composite graft called the bat graft to rebuild this columella, and then use another composite graft to reconstruct the tissue on the tip of his nose where the skin is not healthy. So we're just finishing completing the removal of the composite graft, and it's piecemeal because he's already had surgery where they've already been taken before. Dr. Frederick is still working on the rib. My God, look at this.
Yeah, I know. It's like detached.
I know. Give me a 15 blade. What I don't like about what I'm cutting through,
not bleeding.
there's no blood at all.
I know.
It's straight like a bed of scar. When you know you have healthy tissue, it's gonna bleed.
Yeah.
And this is not healthy tissue. It's poo-poo tissue. Yikes! We've tested Robert to make sure he's not an active smoker. However, here, the damage is done. The blood vessels are destroyed and the nose is packed with scar tissue. The smoking killed all the small blood vessels. We need blood. Blood means that it's gonna feed any type of graft I put there. All right, we need some fibrin glue. Problem is, we don't have any blood supply. I mean, this is composite graft, composite graft, composite graft. And the question is, how much of it's gonna survive? Us doing this, we can just make everything worse. This nose is a mess. This surgery might be a complete failure. The composite grafts that have the rib, perichondrium, and the tissue, they all need blood supply. So we need to go to plan B. And the problem is, we don't have a plan B. I mean, I'm open for suggestions. This is gonna look like poo-poo. Oh. This is gonna look like poo-poo. I mean, I'm open for suggestions.
Maybe we just take the skin off of this.
Oh, take the skin and do the whole thing?
Yeah, skin graft from here down.
Yeah. Oh. So you might even take out my bottom composite that we put in?
I'm taking these out.
Due to what I'm finding in Robert's nose, it looks like my plan is gonna have to pivot. We're not gonna use the composite graft. We're gonna use a T-flap. In other words, take the tissue on the tip of the nose and advance it. And hopefully that will have a little blood supply. We're gonna fold the tissue in. Then we wanna use something called the bat flap, and that is a big composite graft from the ear, skin and cartilage, right here at the mid-columella. As long as he doesn't smoke, cross fingers, cross your toes, the tissue will survive. So what do you think?
I think it looks really good.
It does look better. Thanks to you wonderful brainiacs. Some nitroglycerin. Beautiful. Woo-wee. Pretty satisfied. The first closure with all the composite grafts, there was a very good chance that most of that would die. And I'll tell you, putting everyone's head together and thinking about a different way to close it and move the skin, the nose looks a lot better. So I think he's gonna be somewhat happy.
Hello.
Hi.
How are you?
Good, thank you.
Good to see you.
So, okay, so you're still healing.
Yeah.
We have been checking on Robert routinely to check on his grafts. So right now, we're both happy with the way you look. So we're gonna have to wait and see what happens here to make sure that doesn't push it back in and contract. And you're not smoking, right?
For sure.
You've done such a great job. Continue it. One of the things that we always have to watch out for is the viability of the composite graft, especially the back graft at the columella. And that's one of our most important grafts because if that doesn't work, the whole tip will contract again and shrink. He will lose all his projection. Put your head back for me. Okay. One more time. Okay. Now, the biggest thing that I'm looking at today was the columella. So, got some unfortunate news. The columellar graft is gone. It's gone completely. I mean, there's not one shred of it left. Cartilage and the skin is gone.
You think it's just due to the underlying impairment of
Well, there's a reason. So, for me, just
what other
smelling over you, because I'm like a intense, I'm very, very good.
Yesterday I did.
You smoked post-op?
Yeah, so he's been smoking. I'm pretty sure you smoked probably close to after your surgery.
After
That's it.
1
Bottom
week
line.
after surgery.
You smoked a week after surgery?
Week after surgery, yeah. And yesterday I did.
Yeah.
Okay.
With a glass of whiskey.
Since this graft died, the whole tip is gonna collapse in again. It's just gonna shrink, lose all its projection. And this graft over here, that's gonna just cave right back in. And the reason why all this happened, because Robert smoked. It is so disappointing. Maybe
Anybody
even
around you smoking?
All the friends, yeah.
Oh,
after surgery?
Yeah, after surgery, yeah.
So the disappointing aspect of this was you did so great before. But then after you smoking and being around people that smoked, basically what you did is you took all that good we did and you kind of ruined it.
I can recognize right now if it's my fault is. So what should I say? I did it. I don't know, I did it. So.
All right.
I'm disappointed. I promise you. Yeah.
Well,
you know.
It's kind of a little bit too late.
Okay.
All right, from now on?
I do. Yeah, I do. For the rest of healing process, I'm gonna avoid all my friends who's smoking. I'm gonna do my best to be healthy, to get the best result.
I'm so pissed.
Yeah.
How can you do that? How the hell would he start smoking in 1 week after surgery? It's almost like you completely ignored what I said. I have a feeling he's gonna continue to smoke, and then this will get worse and it's contract, and it's just gonna look just as bad as I did. I'm not gonna, he's gonna have to heal the way it is. Because now you can't trust him.
No.
I put all that work to help him, and he couldn't do his part.
This probably represents, what, $150,000 worth of surgery down the drain?
Yeah. Gone.
Gone.
Let me show you some photos. There we go.
Whoa, rhinophyma.
But when you look at this, I mean, the whole lower third of his nose has been destroyed by this. The normal tissue is gone.
Poor guy. Has he ever had any treatment for it?
I don't know.
My nose is like putty. When I look in the mirror, it's long, ugly, bumpy, and horrific to look at. There's no cartilage in this. It can go all the way down and touch my lip. To either side, I can push it up. My condition is called rhinophyma, and it's a condition where the skin on your nose thickens and grows. 2 years ago, I had a normal nose, and now it's growing about an inch a year. I still have no answer for this. There's no explanation. It's just something that happened.
I haven't played ball in a while. Feels good to be out here.
Baseball weather. Still got it. Baseball's been in my blood since I was 9 years old. Ball fields are my happy place. I love going there. You know, it makes me forget about this until I go home and look in the mirror again.
Before I, left the house, I didn't really notice anything, and then I came back and kind of noticed it was getting worse.
It's getting a lot worse, yeah.
Does it cause you any pain?
No, not really pain, just embarrassment.
Yeah.
People look, they stare, They call you names under their breath.
Yeah, it's gotta be hard.
And it's very difficult. You try to let those comments roll off your back, but they come back to haunt you at night and they hurt.
How's mom feel about it?
I think she's a little embarrassed. I hardly even go out anymore. I don't want people to see me. Hopefully Dr. Nassif and Dr. Dubrow can take on this case and my nose goes back to a normal looking nose.
Still got an arm on you.
Yeah, I know. Not too bad for an old guy.
And here he is.
Oh, hi, how are you?
How are you? Nice to meet you.
Terry
Who's this
Dubrow.
young man?
Nice to meet you.
Sam, how are you?
Sam, where are you guys coming from?
I'm from Richmond, Virginia. He lives in Nashville.
Yeah, I'm in Nashville. Right.
Very cool.
And he's one of 10 children.
10 children?
Right.
Children.
I'm right in the middle, number 5.
What's the range of age?
31 down to 14.
How many wives? One mother.
Wow.
You want to hear some good dad jokes? Why did the nurse ask the doctor for a cow say?
What's a cow say? Oh, what does a cow say?
Get it?
Yeah.
That's a cow say? That was good?
That was okay.
Why did the surgeon ask the nurse for a hen weigh?
What's a hen weigh?
About 3 to 4 pounds.
What's that? Oh, that took me a second to get. What's a hen weigh? Got it. Give us a little background.
About 5 years ago, I was diagnosed with male breast cancer, and I had a mastectomy.
Did you have any chemo for the breast cancer?
I was fortunate.
Wasn't
to,
in the lymph nodes.
Only have the mastectomy and nothing else. And a year later, I just noticed an overgrowth starting on my nose. Dermatologist gave me a topical ointment and tetracycline, and none of that stopped it. And then in the last year, it's gotten really aggressive.
How much worse is it now than it was 2 years ago?
Oh, 1,000 times worse.
Really?
Yes.
Because that is a little unusual.
That is
to
unusual.
Be that quick.
Let's see.
And how long ago was this?
3 years ago.
You didn't have
normal
it at
looking
all.
nose.
Right, I didn't have anything. Right?
Nothing.
Right. And the last year has been really aggressive.
You ever heard of this?
Never heard of it.
Because of the breast cancer, I was diagnosed with a high estrogen level.
I'm wondering if that higher estrogen level accelerated this. Rhinophyma is simply untreated acne. In my career, I have never seen a rhinophyma grow this fast. However, due to the intake of hormones, especially estrogen, that could be the link or the cause for this rapid growth.
When I moved up for college, normal nose like nothing. And then when I came home, I was like, did something happen? Did you get hit in the nose,
Has it affected the way you breathe?
It has. It's starting to block this side because it's growing in that direction.
Yeah.
Does it drain any kind of fluid ever or any kind of...
pus comes out of it constantly. And it's gotten to the point where it's, ugly, socially unacceptable. You hear people call you names and they stare, and it's affected my life. It really has.
Oh, of course it has.
And it's something I really think I need to take care of. I've read that at this stage, it will not stop. It'll continue to grow. Really, the only remedy is surgery, removal, and there is always a chance that it could grow back. Hopefully it doesn't.
That's my biggest worry when I see a nose like yours is it gonna stop? Is it gonna heal well? There's a possibility with my exam, I might say to you, Andy, this is more than just removing the rhinophyma. It's reconstructing your nose. Can I ask you a favor? Can you take off your glasses?
Sure.
Let's see here, we're gonna look at it. Yeah, it's pretty heavy.
Well, it's really stretched the skin, hasn't it?
Yeah.
Let's take a look inside. So you have a deviated septum, which is occluding almost all of your airway on the left. Andy has bilateral nasal obstruction. I don't know how he's breathing it all through his nose because the right side is collapsed from the rhinophyma and his septum is deviated all the way to the left. So we have left side nasal obstruction and right side nasal obstruction. I feel about a layer of this thick of tissue.
Yeah, I know.
Which is more rhinophyma tissue. So I think when I look at your nose, I think the things we're gonna have to do is, number one, I wanna fix that septum of yours, no matter what, and get you to breathe better.
Okay.
2, some instrumentation to debulk the rhinophyma.
Okay.
The risk is it going to grow back?
Right.
There's a treatment, it's called J-plasma, which is a helium device with radio frequency. It creates a plasma.
Okay.
I want to try to use it to stop some of those sebaceous glands from producing what it's doing now. What's scary about doing this is if we get too deep. That's the scary part. And if we do get into that deeper tissue, it can create like a glistening white scar. Now that might even be better looking than what you have now, but it's something that we'd love to see you trying to just get a normal looking contour back.
Sure.
But that's a big risk. What do you want to do?
I want to go through with it. You have not scared me off at all. And I think the results, regardless of what they are going to be an improvement.
You have a very interesting problem.
For you.
And we always say you never want to be interesting. And by the way, if you're interesting to us, that's
unique.
A euphemism for really hard, but really cool.
I'm in.
All right. There he is, the man, the myth.
Hey, how are you?
How you doing, buddy?
Good.
How's it going?
Going good.
Well, you ready for this?
I guess so.
Our goal is to take this cautery loop.
And we can actually shave away the layers.
Okay.
Okay.
So just like shaving.
All right.
All right. We'll take great care of you.
Cut till you're happy.
Ooh, I like that. Cut till you're happy. For Andy's surgery today, I'll perform 2 procedures. First, I will use the loop to debulk the rhinophyma, carefully shaving away the sebaceous tissue. Then, using the J-plasma tool, I will use helium mixed with radio frequency, creating a plasma to resurface the remaining tissue, while hopefully preventing the rhinophyma from growing back. Lastly, I will do a septoplasty to correct his deviated septum and help Andy's breathing. The biggest challenge with Andy's nose is seeing where we have normal tissue. We have to go down and remove enough skin to make sure that we get all this rhinophyma off, but at the same point, leave his normal skin. All right, can I have it? So this is the loop device. So we're gonna use this to sculpt this. We're gonna gently peel off the skin. This is a cautery device. The loop cuts through the tissue in a very soft way, and you can control it with the different size loops. Yeah, this is Parmesan cheese. What makes this difficult is you really can't see the normal borders of tissue because they've all been destroyed. So some of this is by feel of how deep you can go to really sculpt Andy a new nose. So we removed most of the rhinophyma. Now we want to do the plasma. We're going to blend in everything and treat the surrounding skin. It helps disinfect the wound, plus also resurface the tissue. The biggest question is, how is Andy's nose going to heal after using any device to remove the rhinophyma? The Renuvion, it's more of a controlled treatment, so hopefully that will give us the normal skin returning back and not the rhinophymatous skin. Let's take a look at his septum. All right, so he's got a really bad deviated septum. Huge spur into the left airway. It's touching his inferior turbinate. Woo, wow. Let's see if I can get this out of the nose. All right, that's a good piece of septum cartilage. When you're fixing a deviated septum, your goal is to only remove the portions of bone and cartilage that are causing the obstruction. And you can't sometimes just remove one large piece. You have to get in there, use our mallet to remove small pieces of cartilage that are obstructing Andy's airway. Here's more bone. Well, I sure got that. Oh yeah. Woo! Watch this. Remember, I couldn't get anything here before, and now watch this.
Great.
Wow. That looks great. Beautiful job. As usual, thank you, you wonderful team. How are you?
Doing good.
So first, before I do anything, what I want to do is I want to examine you. Then I'll give you the 411 on everything. You okay? Yeah. Sorry about that. Good.
I like the dressing you did with the telephone.
Yeah.
Good job. That's the cautery. First of all, it looks great.
The way his nose looks is not that pleasant, but it's absolutely normal. I mean, what we did was remove that whole thick layer of tissue and skin. Now we need time for him to heal.
How you doing back there? You okay?
Yeah, I'm good.
If you're not, you go sit down over there against the thing.
Okay. I just don't want to stare at it.
Don't stare at it. This is kind of a little bit different looking. Get set. Go.
Looks great. Look at that, a real nose. Wow, I can't thank you enough. That is
There you go, brother.
fabulous.
Heal well.
I lived with the rhinophyma for approximately 3 years. It was just like a piece of putty hanging off the end of my nose. I never thought I would have a normal nose again, but thanks to Dr. Nassif and his team, I finally have a normal nose again. I feel fabulous, and I'm not embarrassed to show my face anymore.
Hey, Dad.
I brought the tackle box.
There he is. All righty. Made it.
How are you guys?
Good. Doing good. We're just getting these poles ready, waiting for you.
Yeah, you ready to catch the big ones today?
Yes, sir.
All right.
Get on out there.
This year, my family and I, we went on a cruise to Mexico. It was great. I had no problem talking with people and showing off my new nose, especially when I won that hairy back contest.
The hairy back competition. I can't believe we got you to go up there.
We were participating in a game show, and they needed someone with the hairiest back. I wasn't afraid to go up there because of my nose, and actually we won. You know, when you're tops in your field, you gotta go for it.
You know, they were up there screaming, "Take it off!"
Yeah, well.
My dad's nose looks great. He smiles every time he looks at himself in the mirror. Now he's going out, enjoying things again, whereas before he was just sitting at home, not wanting to do anything. And I thought he was just getting older, but it really was just his nose and his confidence. And Dr. Nassif restored that for him.
All right, so I guess put some more baits on. You got your weight on?
Yeah, I'm good to go. Thanks to Dr. Nassif, my breathing is sensational. I don't snore any longer, and my nose is healing, but it's not growing. I'm optimistic that it'll stay this way for the rest of my life. Dr. Nassif and his team have given me back optimism. They've allowed me to look to the future. I don't have to hide behind an ugly nose any longer.
I think if Dr. Nassif helped your snoring, that's probably the best thing he could have ever done.
That was better than anything, right? I feel like I can conquer the world.
All right, Captain, fire up that boat. Gonna do some fishing?
Yeah, ready to go.